we need to be able to balance the political considerations with the need for data. And so do we have the appetite for data? Yes, we have the appetite for data. Do we have the capacity to generate data? We have the capacity to generate data. But we also must look beyond the policymakers. We have a situation where we have a lot of support. Every partner that comes to Nigeria to work in the health sector wants data, right? And they are prepared to put their funding in the data. But what we find is that there's no integration, or there's lack of appetite on the part of funders to integrate resources to get national data. Everybody wants to get a particular data to push their own agenda. Of course, that cannot be useful. So we have a situation where the sector, as far as data is concerned, is almost adequately funded, but there's no progressive or incremental, there's inadequate incremental improvement in the outcome of usage of data, because the resources put into the data are fragmented. So we must have a situation where, when we are talking about Paris Declaration on Aid Effectiveness, for instance, and all the issues around it, our experience is that partners sign up in Geneva and Washington, D.C. and New York what they want to do, but when they come to the country level, they do entirely different things. So we must have a situation where if we put all our cards on the table, the policymaker must demonstrate their appetite, which they do, because they really need the data. And at this point where we are going to be looking at a post-COVID economy, there will be so much contest for very limited resources. We actually now, more than at any time in our policy-making history, need data. So we also must therefore bring together all our resources, to put together and identify what are the baseline data that we must have, the development indicators, what are the indicators for the health sector that we must have in order to drive a post-COVID health sector. And so we, as policymakers, must put our mind to it, and the funders, the programs that bring resources also must back the government adequately. And we should be able to make a lot of progress. As a health sector, and all of us here are in the health sector, whether you're a policymaker in government or you're in the university as a researcher, whatever else you are, as a health sector, we also now must address the issue of a post-COVID health sector. A post-COVID health sector is a health sector that must address the issues of continuity of services, must address the issue of global health security. They must address the issues of financing the health sector in the midst of so many contending issues. We also must address the issue of people being tired of health problems. I mean, it's like, okay, you people are always giving us trouble, right? So we need to dispense of you. Maybe if we press delete, we can forget about health problems for some time. It doesn't sound real, but those are realities of our life. So we therefore must come together and then begin to look at how can we address these issues. The funding is not endless. The people who used to support us are also in a situation, in a precarious situation themselves. So we'll be expecting that external support and aid will also be decreasing, and the problem is increasing. So data and more data is so critical at this point in time. And we must not just collect the data, we must make a good case with that data. For a policymaker in the health sector, that is so key, because we want to demonstrate that in spite of all the investments made so far in COVID, we hear all kinds of announcements and resources. Individuals are making investments of their own destiny, and they're saying they are giving it to the health sector. Those will become issues that we must address. So why do we still need more resources to create and build a more resilient health system? And that's what we must do. So yes, to your questions, I hope that answered some of the concerns that we have here. Thank you. Over.
Thank you, Dr. Azodoh. I mean, you really, echoed part of the discussions that was raised yesterday, that there's need for coalition to leverage opportunities that the different donors and funding agencies, present to us here in Nigeria. I mean, one, really strong point that came out from yesterday's discussion, that there is need for strong development cooperation. Just like you said, there's a lot of data being collected in country, but we see that the donors and the government, there's no alignment in terms of coming together, that cooperation. So there's really need for that coalition. And one of the discussions from yesterday, which you also are saying today, is the fact that as a country, we need to fund our research so we can control really the research priorities. So funding, government commitment to funding is really critical. Next question will go to Chinekwu. I mean, being that you've been working with the Governors Forum, I mean, what's your take in terms of, from your experience, working with policymakers, the politicians and all, what's your experience in terms of the demand and the appetite among these policymakers for evidence? What do you think from your experience drives considerations for policy making? Is it evidence or maybe political considerations only?
Thank you very much for the question. And once again, I want to appreciate the HSG for putting together this program. And then going to the question, I largely agree with what the previous speakers have said. First of all, there is no way we can overlook the place of politics in decision making, because when the chips are down, the decision makers largely affect politicians. But regardless, the political consideration should not override evidence. So there should be a balance. Evidence should be used, whereas while having political considerations in place. So with regards to the appetite and demand for evidence, one thing I would have to say is that the users are supposed to create the right kind of demand. And from what we have noticed in the past, there's been this observation that the health sector, if I might put it that way, more or less do not project the right kind of evidence. What do I mean by this? First of all, with regards to evidence generation and dissemination and all that, there is a need to pay attention to the target audience, because your target audience largely determines the type of messaging and the manner by which you pass across whatever messaging you want to pass across. So what we have noticed in the past is that when you want to engage with these decision makers, sometimes we come with highly technical information that is more or less complex, which does not resonate with them, which they cannot identify with. So it's kind of not relevant. So it's important that relevant data is presented to these decision makers, and the data that they have access to the data in a timely manner. Like Professor Uneke had said, there has been a disconnect between the quality of research going on in the academia and the needs we have in the policy space. The academic research is largely academic. So I commend what he's doing, and that is where the thrust should be. More focus on relevant research. And then also within the space, the health sector space, there's not, relevant data is not easily available and accessible. You'll find out that most of the times what we have is population-based data, which is not regular. And routine data is not really used now because there are issues around the quality of the data, and then there is no access to that data. So what I would say is that we need to go back to the drawing board and find out a way to present the data to the policymakers in a way that they can understand. We should drive the demand for evidence. And I must say that within the space where we work, we've been studying and trying to understand how the policymakers think, and we try to tailor the data, the information, the evidence to suit them. So for example, let me give a typical example. Most of the data we have out there are normally outcome data related to outcomes. And then when you present this to governors, for example, they do not understand the processes that lead to the outcome. And you find out that where their decisions coming from will be with regards to those processes, those enablers, because that is where they are able to influence. So there has to be a mechanism of throwing those processes at their faces in a way that they understand, and then ultimately show them how having these processes in place will impact on the outcome. So we need to do some more work on ensuring that we provide the relevant data, and then that we don't overload them with data. For example, we have meetings and some organization wants to come and make a presentation and advocate for why governors should budget more for whatever thing. And then they come with 50 slides with a lot of charts and graphs and all that. So they've not put the audience into consideration while trying to present the data. And then another thing is that, like I said, you tailor whatever information to the audience. Now, a lot of research is carried out at the national level. So we provide national level statistics or data to governors. They cannot relate with that. They'd rather state-specific evidence, because that is what directly affects them. So what we've tried to do is that we've tried to come up with a criteria for coming up with indicators that we want to follow up on, and we encourage people that we engage with to try and use that strategy. So it's simple enough for the people that you want to engage with them. Of course, if you're talking to technical people, people that are implementers, of course, the narrative will change. But with regards to the policymakers, we try to make it as simple as possible, measurable, and ensure that the data is available. So in summary, what I'm trying to say is this: we cannot overlook political considerations in decision making, but that should not be at the expense of evidence. And then secondly, as the health sector, we should do better in ensuring that the decision makers have access to relevant data, and it is presented to them in a simplified manner that they can understand and utilize. Thank you.
Wow, thank you so much. Thank you so much. You know, you really mentioned a lot of really insight into the discussion. You know, I just want to recap some of the things that you said that I think are really key points that we must take notes. You know, and that, you know, one of it was that relevant data must be available and accessible all the time for the political actors to act on, and that routine data also must be made available. Process data are better enablers as against outcome data. And you know, that's like a question here or a recommendation from one of the audience here, you know, saying like what Professor Uneke is doing with his students. Prof, they are commending what you're doing with your student here. You know, that perhaps one of the output of this program would be to create a forum that links both HSP researchers and policymakers together, and probably schedule regular time for meeting to discuss this need. So, I mean, that's really very key from all the insight that we are getting right now. Thank you so much, Chinekwu, Oreh. Thank you. So our next question will go to Dr. Adura, and maybe you'd share some insight. You know, what do you think from your experience, how far do you think Nigeria really has progressed in terms of utilizing evidence, you know, being on both sides, both on the side, I mean, you've worked as a researcher and also in implementation. You know, from your experience, how would you rate the progress of Nigeria so far in terms of utilization of evidence for decision making?
Yeah, Rita, thank you very much for your question. And once again, just echoing what every other panelist has said, this is a fantastic forum. It's probably the closest I've gotten to policy people, which is great. But it's great to be here. Thank you very much. To your question, I think it would make sense for me to kind of just build this gradually. Maybe highlight, first of all, that I agree largely with all that many of the panelists have said. And undoubtedly, better use of research evidence in developing policy. I mean, we know that this can save lives. You know, it's more effective policies also help to respond to scientific and technological advances. And certainly use of those resources helps with improving use of those resources, making it more efficient, and hopefully we are also meeting the needs of our population. But this is no doubt for me, but actually trying to figure out the cause of the problem for me looks like being in a situation of throwing multiple arrows, pointing into multiple directions, yet claiming to go in the same direction, right? The local researchers are probably better placed to understand local problems. However, do local policymakers truly trust the outputs from local researchers? I mean, it's great to hear some of the comments being made today, but I know that many governments would rather go to, and I'm not trying to make anybody lose their jobs here, McKinsey and KPMG, to do some of the very nice, fluffy charts for them because, it's just better for them. But also, do local researchers have the funding to answer some of the difficult questions that need to be answered? The foreign researchers will come in, they come with their foreign gaze to explore issues, probably more in greater depth because there's funding to sustain the work. Okay, well, they do it on their own mandate and not necessarily on the mandate of the government. So I take the point that there's some disconnect in communication in that space. But then they take their findings, get it published in some subscription-based journals that policymakers do not have access to. But even if they had access to that evidence in those journals and it was open-based, well, do they really understand what is being published? Really, publishing for me does not mean that that evidence has been presented to policymakers, like Chinekwu just mentioned also, that you need to present it in a simplified manner. They certainly do not understand or care about p-values or confidence intervals that are being shared. I'm super glad by the progress that Professor Uneke mentioned that has been made, and I'm happy that he's really in the position to be chairing this panel, because he has certainly followed this process from when literally there was nothing to where at least there is something that we can hold on to. And I'm particularly encouraged by the 30% score that he gave. But for me, I feel strategies such as training and mentorship, yes, they are super helpful because at least we're starting that process. But what is the critical mass of policy actors that we need to train for this to really become mainstay? And who is being trained? At what level are they being trained? If we train civil servants who work in the Ministry of Health, is that sufficient? Or should the elected governor or the senators also be trained to understand and to be able to use evidence? And I know someone previously mentioned about the capacity within the ministry to use and set up evidence. Again, this is exciting and good to know, but I look at examples such as the COVID-19 response today, and I'm asking myself, at what point in time does evidence come in the whole decision-making process? And for me, that is not particularly clear. Appetite and capacity is just not enough. The process that specifically translates research into decision-making should really be the focus. And that's what I think. I can give an example, for example, from what my work in Lagos State and how we've kind of intersected with policy, because the critical question I was asking then was, how do we decide where to build hospitals, for example, specifically for pregnant women who are trying to access care? Is it based on votes, which local government will I get the highest amount of votes that will vote for me in the next term, or is it based on need? And I went out to kind of explore this issue with my team on ground to find where are the hot spots so that we can advise the government when they're thinking of building or upgrading, for example, primary healthcare centers going forward. In doing this, the engagement and the discussions with the government started way before the research itself commenced. We're thinking about this. Is this something that will be of interest to you? You know, this is why we think this is particularly important. And maybe this is a point for me to actually draw on to one of the conversations earlier on about trying to match the research agenda with the need. Because yes, indeed, it's great that we focus on need and we're trying to address what the ministry particularly needs, but I think it's also important that we do not let go of the potential for discovery that research can offer. That is sometimes even the government is not aware that this is a problem, but researchers who are keenly aware of the context issues can expose and bring to light to the government. So yes, we then went, explored this, got the government on board, as I mentioned previously, and we've been working together. You know, we are still very much in this process of identifying these places for the government, but we know that yes, now that we've identified this gap for the government, it has matched the need, and the clear process on how that research finding is going to be integrated into decision-making going forward has also been identified. And I think for me, that is where the emphasis has to be, not just on pointing the arrows in different directions, blaming the funders, blaming the researchers, blaming the foreign researchers, blaming the government, blaming the politicians, but how do we specifically move this forward from appetite, from capacity to action? And I think I'll leave it from there. Hopefully, if I do get another round to communicate some of my thoughts, I'll be sharing specifics on how I feel that approaches that can be employed on how we can actually translate into action. Thank you.
Thank you so much, Dr. Adura. I mean, you raised a question, which for me, it's like the indicator to really measure our progress in terms of how far we've gone in terms of utilization of evidence in Nigeria. You asked one very key and relevant question. You know, do local policymakers trust the evidence from local researchers? You know, I mean, I think it's nice to really get the experience of those on the field here in Nigeria. You know, I mean, what do we think? Professor Uneke, you know, what's your opinion on that? Do local researchers, you know, or do local policymakers here in Nigeria trust the evidence coming from local researchers, or they would rather want the evidence coming from foreign partners?
Well, thank you very much. That's it's a tricky question, but the truth is that you can't make policy without local evidence. Because for the policymaker who has not yet developed the skill for contextualization, you can't contextualize evidence from another country into your own setting if you don't have the skill to do that. So your best bet is local evidence, and because you are dealing with local policy issues, you want to improve the health outcomes of the people within the country or within the community. So you can't get evidence from other places that perhaps they are not similar setting. So the best bet for our polycom countries is to make use of the local evidence. But the problem we are having is not that our people don't know or don't have the capacity to generate evidence. I mean, go to the universities. We are trained in the universities, and you see the capacity, you see the resources available in the university to conduct research. You can't get that any other place. And then you see highly trained people in the university teaching research, carrying out research, and then some extent, some funding coming in, though not sufficient, but it's there. So there is no other place where we can be sure of getting the kind of research we need to improve our policy-making process and health outcomes than in our institutions within the country. But the problem is this: there is a disconnect between those who are in the position to generate research evidence and those who are in the position to use the knowledge generated, and that gap, once you succeed in bridging it, you would have solved 90% of the problem. Let me give you an instance. Some years ago, when I started this, have to take evidence into policy making, it was difficult because my colleagues in the university didn't see any reason why anybody from the university should go and start meeting people in the health ministry. In fact, what the orientation we got when we came into the university almost 18 to 20 years ago was that the university is an ivory tower. I mean, you just stay there. You don't need to contaminate yourself, in quotes, with the society. You don't get involved in the politics of the society. Don't get involved. Just do your research. You are cut out to be in the ivory tower, doing research and getting findings and moving forward, and you get your professorship and then you have arrived. That was the misconception, let me put it that way. But that was the orientation we had when we came into the university. But I looked at it and I said, no, from my own original background as an infectious disease expert, I saw that the interventions we have generated, maybe from the university research, that they are very, very effective. But why is it that those effective research interventions to deal with some infectious diseases of poverty, for instance, we are not seeing the desired impact in the society, in the communities where those interventions were deployed? So it got me thinking that something beyond just having the best intervention strategy is required. So it goes beyond just developing maybe diagnostic tool, developing prevention tools like maybe the ITNs. It goes beyond developing treatment tools like drugs. It goes beyond that. There is the systems issue, there is the community issue, there is the culture of the people, there is the societal norms, there is the societal value that you need to also put into consideration in the intervention processes. I remember, for instance, one of the interventions we had so many years ago where the nets, insecticide-treated nets were distributed. And then people collected the nets and they told us that, if they sleep under the net, they dream bad dreams. And you can't stop, yes, the net is effective, but there is this social issue that you also have to deal with. Some people use the net for something else and they don't even use it. So it's not enough to develop interventions. You need to also look at the situation of the people, their culture, their tradition, their values, their belief systems, and their way of life. And policies need to be made with those things into consideration. Otherwise, it will not work like what we have been seeing in the country. So what I did was to take the bold step of going to the people in the ministry, especially the permanent secretaries, the commissioners. When anyone is appointed into the ministry, I go with my team to pay courtesy call. And I tell them, look, Mr. Commissioner, we need to work together. We in the university are here to support you with evidence that will be necessary for you to do your policies so that it will impact much more effectively on our system. And, to our greatest surprise, it worked. Sometimes we think that the policymakers don't want to, are not interested. But I tell you, and I'm saying this categorically clear, some of the policymakers on the panel agree with me. The policymakers are interested in local evidence. But the thing is that somebody has to make the move. And, I call on my colleagues in the university. You don't stay there in the university. You need to make a move. And that, created what I call informal relationship with policymakers. It is very, very important. Let me say this categorically clear, that one of the major success factors in bridging the gap between policy and research is for the building of relationship between researchers and policymakers. I can tell you from 2008, every commissioner that has been appointed in my state I build relationship with them. I still have their phone numbers from 2080 date. Every commissioner that is appointed in my state, I go to build relationship with them. So because of that, I have a very cordial working relationship with the Ministry of Health, that so many of the programs they do that requires somebody from the university providing them with the technical support, they come to call me. And it's not as if I am the only professor in the health sector, health research in the university. No, but it's a matter of relationship. And I've started doing the same at the national level, even to the point of the National Assembly. You need to build relationship, because it's on the platform of relationship that you can really make impact. Some of them who are policymakers, they'll tell you that, please, they need information on this. Can you provide it for them? Sometimes it comes so suddenly. And that's why we start developing what we call rapid response services, where we provide policymakers with information they read rapidly, because the policymaker, like some of my colleagues on the panel, they don't have all the time to start processing information and wait for you to finish your 1-year research and provide them with the information. No, they don't have that kind of time. They are under pressure all the time to deliver. They may be given maybe 1 month or 2 weeks or 3 weeks, and nobody has the time to come and be waiting for a researcher to complete a 1-year research and all that before providing information. So the relationship, matters a lot. And I think that is the #1 thing that is lacking. There has to be a way to get researchers and policymakers to start relating, beyond just formal relationships where you have platforms where you come together. They should build friendship. And then another thing I want to also say, this thing, it's a two-way thing. Researchers have to make effort. The policymakers also have to make effort. That's why when we talk about knowledge translation, there is the aspect of the push, and then there is the aspect of the pull. When you are looking at the models, the push is when the researchers generate evidence and push it to the policymakers, while the pull is when the policymakers themselves request for the researchers to send them evidence that is required for their own policy making. And this is how they can do that. I'm talking from the perspective of the policymakers. Policymakers can actually commission research. And when we talk about commissioning research, your mind should not just go on you bringing money, maybe as the Ministry of Health, and giving people in the university to conduct research. That it goes beyond that, because we know that you don't have all the money because of the inadequate funding that we have seen in our system. You don't have all the money, so you may not have the money to go and give and say, we are commissioning this research. But when there is a relationship, if, for instance, the director of public health in the ministry has a good relationship with maybe the professor of community medicine in the university, there could be some interventions, like maybe they are looking at intervention on to eradicate maybe gender-based violence in the rural areas, or something like substance abuse among youths in the rural areas. That director of public health could talk to the professor of community medicine in the universities. We need information on this. Every year, students go out to conduct research so that they can have their degrees. The professor of public health or community medicine can give those topics to his or her students, so that the students will carry out that research. Instead of like what we see today, where lecturers will tell their students, go and search the internet and bring 3 topics so that I will choose one for you. And then the person goes to the internet, is searching for topics that have no relevance to the main thing happening within their own countries. So that's where things need to be corrected. And I'm using this opportunity to appeal to my colleagues in the university. We need to correct this, because when you talk about evidence, we have more than enough evidence in this country every year. I mean, look at the number of students we graduate every year, not both at the undergraduate level, postgraduate level, PhDs. All kinds of evidence is available. but they are not reaching the people that need it to use it for policy. So we need to build relationship. That is the number one thing, and I can say the most important thing that is needed. And then, like one of our colleagues said, there is need for platforms where policymakers and researchers can come together. We have been able to successfully drive this with the Department of Family Health and the Department of Research, Planning and Statistics of the Federal Ministry of Health. The West African Health Organization is supporting a project on moving evidence to policy in maternal, newborn, and child health in 6 West African countries. And I am privileged to be the national consultant for the project in Nigeria. And what we have done through that process, from some of the models I introduced to them, is that in addition to building the relationship between researchers and policymakers, that we should also go ahead to establish what we call Research Day, Maternal, Newborn, and Child Health Research Day. And that has now been integrated into the programming of the Family Health Department of the Federal Ministry of Health, such that every year the West African Health Organization sponsors the Research Day, where policymakers in maternal, newborn, and child health sector and researchers who are conducting research in those areas, we come together to start looking at how far they have worked in the previous year, what are the new things that have come up, how to look at the critical issues, like you do something like a priority setting exercise to identify the critical areas that research needs of the policymakers are required to be supplied. And then when we come for such meetings, as we're going back, we all know the areas that our colleagues who are on the policymaking side require. And once we come back, we all the research we are doing with our students will be centered on that. And when you do that, you discover that you have succeeded into a large extent, bridging the gap. And that's what we need in this country. So this kind of engagement, we should find a way to make sure that we are having these two sets of people meeting at each point in time. To our colleague, Dr. Azodoh, I know that, Ministry of Health, they have meetings, they have programs from time to time. But what I want to encourage you people, when you are inviting participants, you should also extend it to the academia. Even though, you may not be able to invite people outside Abuja, but I know there are a number of institutions, universities in Abuja, where you can invite professors in the health sector, let them come and participate. I believe that when we have them participating regularly in programs like this, under such forum, relationships can be built. And this is our culture. We are Africans. Things work on the basis of relationship, because people can make sacrifices on the basis of relationships. I have invited a number of policymakers to my programs. They came not because I have money to sponsor their coming, but because of the relationship I have with them. They came to such programs. And when they have theirs and there is no money allocated, maybe for the payment of a professor to attend such meetings, but because of the relationship I have built with them, I go to also support them in the program. And in the process, there is this exchange of, ideas, exchange of understanding. We get to work, tailor our research from the lens of the policy making, and then also the policymakers begin to generate their policy questions from the lens of the researcher. So it's very, very important. Let me share this very outstanding experience we had, which I've also introduced it to the WHO, and is becoming a model. So many countries are now beginning to pick that. In 2015, 16 or thereabout, I got an initiative to introduce a secondment project or program between the university and the Ministry of Health. So what I did was that I contacted the Commissioner for Health and introduced the initiative to him, and then of course spoke to the management of my university, that instead of professors going to universities to do sabbatical, leave? Why don't they go into the ministry and do the sabbatical leave? And then instead of the senior people from the ministry going to another ministry on secondment, as they call it there, let them come into the university and do that secondment. So there was a two-way exchange where some of us went into the health ministry, as secondees, and then some senior directors in the health ministry came into the universities, into the university as secondee. And what happened? The policymakers from the Ministry of Health, we put them to teach some courses, our health policy program courses in the university. And I can tell you, there is nobody who has the kind of experience they had. There is no professor that had that kind of experience, because they are the practical people. They are the ones that deal with the politics of health policy. They are the ones that deal with, all the systemic issues. They understand it. Those of us in the university, we know the theories, we know the models, but the practical experience are with the policymakers. So we had policymakers who now came into the university in our programs to teach the practical aspect. We gave them courses and told them, you don't just need to develop handouts and develop slides. Just come and tell the story. Come and tell us how you were able to navigate through a political challenge in the policy making process. And people learned a lot from their practical experience. Then those of us who went into the ministry, we were now able to build the capacity of the people in the ministry, especially those in the Department of Planning, Research, and Statistics. We taught them how to assess research evidence, taught them how to synthesize research evidence, taught them how to adapt and apply research evidence. And, which under normal circumstances, they wouldn't have been able to get to know that. So one other thing we did was that some of those policymakers that came into the university as secondees, we now place them into our University Research Ethics Committee. We had about 3 of them in our University Research Ethics Committee. And therefore, everyone who is submitting a proposal for ethical clearance, if there's no policy implication of your research, the committee will not approve it. So because of that, people now started tailoring their research deliberately to be able to have policy implication. We had challenges with our colleagues from the physical sciences, maybe those in physics, those in mathematics, because they will tell you, how can you tailor physics to now have policy implication? I say, I don't know, but go and find out how this your work can affect human beings positively and improve life. And you see, for the first time, many of them now began to, tailor their even physical sciences like mathematics, physics, chemistry, to begin to have, a way it relates to the improvement of the lives of the people. And it was exciting. The research now became real. Research now became tangible. Research now became, something that is very, very relevant. So these were some of the things we did. I published papers on this, so many of the papers are available online. The secondment program, is a model. So these are some of the areas that I think if we begin to pursue it aggressively as it is now, we'll be able to move the 30% to somewhere around 60, in the next few years. And I am very, very sure that some people have got some vital information they need to work with so that we can really move this evidence to policy interface further. Thank you very much.
Wow, Prof, you just said a lot. If you look at the comment box, I'm just wishing, like, do we have all the relevant audience that would take this message out there? So please, to our audience, please, on Twitter, please tweet some of the key points you are getting from this discussion, because importantly, is really to take this knowledge to action. And Prof, thank you so much for the work that you're doing with your university and with your students. I really just wish that these very key examples, that you're doing, can be scaled up across, all universities and above. So please, please let's tweet this so it gets, let this conversation go loud so that all who needs to hear this must hear this. The changes must be made. Prof, just one more question from you before we move to the next participant. I think this question is best, addressed, by you. Somebody is asking a question here. What's the question? Okay, yeah. What would you advise young researchers with limited access to policymakers? You stressed the importance of relationship between policymakers and researchers, as the bridge to, close that gap between evidence production and utilization. So the question is, how would you advise young researchers with limited access to policymakers to go about disseminating their research findings? Is there any room for engaging the Nigerian populace to create the demand in the instances where this affects their health, such as the examples you were citing? Yeah, so
yes,
if you have any recommendation for them.
Yes, thank you very much for that. The problem we are having is that the older researchers don't believe in what I'm saying. It's been a problem. I know the kind of challenge I had convincing my fellow professors that we need to leave the ivory tower, for goodness sake, and there is what is called let the gown meet the town. We need to do that. Wow. Otherwise, all the work we are doing, people will not benefit from it. But unfortunately, I'm not getting the kind of response that I needed to have. As a matter of fact, it is only the young researchers, the upcoming researchers, that are buying into this, that are seeing that this is real. They used to say that you can't teach an old person how to use left hand at an old age. It will be quite challenging, but you can teach a younger person how to do that, and then you will not have too much difficulty. So some of them believe that maybe they have passed the stage where they will start going, somebody is a professor. How can a professor go and start looking for a permanent secretary, and all that? He's just on top of there and all, but there is what is called academic humility. And for goodness sake, for the sake of the system, sometimes we need to put aside our attainments and see how we can really come down to see how the system can work better. Like I told you people, anytime a new permanent secretary or new commissioner is appointed, I take my team and go and pay courtesy call. It's just a way of showing that, look, we need to work together so that we can change our system for good. We need to work together. And they have always appreciated it. Let me tell you something. Policymakers are highly receptive when you present the fact that, and I used to call my colleagues, please, we need to initiate this. They may not want to come to us in the university, but we have to go to them for the sake of our system. So let me say that, as I answer the question. Now, in case a young researcher, maybe the older people, the older ones that are supposed to be your mentors, are not really encouraging you in this, you don't have to be discouraged. You can go yourself. There are programs that the ministries of health hold. You should be able to have information on the programs that ministries of health hold. There are some of them that are open program that it's not by invitation. You don't need a card. You don't need an admit card to attend. Attend such programs. I used to, that was what helped me. I attended ministries programs that I was not invited specifically, but it was an open invitation. Maybe I heard about it in the radio. I attended. And you see, when you get to such meetings, you will meet maybe the director of public health, a director of reproductive health, who will give a speech. After the program, approach the person and say, excuse me, ma, thank you very much. From what you said, I learned a lot. I am a lecturer from this university, and I would like to have a word with you. Please, can you give me a time to visit you in the office so that I can discuss with you? That is how it starts. They said, if you want to know somebody, go and know the person. There is no two ways about that. Our culture is built on relationships, so we should take advantage of that. There is nobody you will meet in a meeting like that, and then you politely request that you want to have a word with the person. Any policy maker, the person can oblige you. And another thing I used to encourage people, if you go to the ministry, for instance, you will still find people that are also beginners. You find people who are your peers. You find people who are almost at the same level. Maybe you are an assistant lecturer. You can find somebody in the ministry who is also at the beginning of his career. You know, when you are almost at the same age bracket, you can relate. And that person can be your link person to the ministry. If the person can take you and introduce you to the director, take you and introduce you to the permanent secretary. That's how it works. It's not a big deal. You don't need money for this. All you need is relationship, skill. And that's what I'm teaching you. All of us that are listening to me, you have relationships. Look at the number of numbers on your phone. Some of you have up to 200 and 300 numbers on your phone. You have relationship. So we need to take advantage of that in the bridging of the gap between evidence and research, because if somebody is not crazy enough, like I used to say, to drive it, nothing will get done. So as you are leaving this place, I don't know whoever asked that question, as you are leaving this meeting, go straight and start looking for how you can start building relationship with people in the ministry. Before you know what is happening, the commissioner will become your friend. And then you can begin to make the small contribution you can within the area that you are operating. And another thing I will advise is that as you initiate it, look around in the university and get like minds. Look for people that, you know, that can be able to buy into that initiative and form a team. That was how I started. Let me tell you something. It was not very easy for me when I started in 2007, 2008, the journey into health policy and health systems. There were some individuals I contacted who were my senior at that time, because I was not yet a senior person in the university then. And they didn't buy into it. So I left them and looked for my peers. I looked for people, that time I was a lecturer 2 or so. I looked for people who are also at that level and shared it with them. So all of us started together. Today, all of us that started it together in 2007, 2008, we are now professors. If you look at our institute's website, you will see some of the professors there. We started together as, you know, junior lecturers. So you don't give up. Even if your senior colleagues are not ready to support you, have a nice support from your contemporaries and peers who are interested, and start driving it. Before you know what is happening, shocked at the level that you will get to in this, because the opportunities are there. There are, you know, a lot of prospects, because that's where the whole world is talking about, even beyond health. Food and Agriculture Organization is talking about evidence. The International Labour Organization is talking about evidence. UNESCO is talking about evidence. UNICEF is talking about evidence. All the world, you know, established international organizations. Everybody is talking about how to move evidence into policy, because that is what is going to work for us now. Thank you very much. Sorry I took a long time, but I'm so passionate about it. Thank you. Thank you.
Prof, thank you so much. Thank you so much. You said a lot. Let the gown meet the town. Please, let's tweet that so that the gown would meet the town. We really must make those changes. I mean, one key thing you have you know, said to the young researchers, that resilience, persistence, and then, you know, building like minds, building relationship, you know, gradually will build the needed critical mass to make the changes. Thank you so much, Prof. My next question will go to Dr. Adura. I know you've said a lot around, you know, key questions that we should be asking. So, I mean, what are your recommendations, Dr. Adura, if we must make the needed change to bridge that gap? You know, what are the entry points? What are the key considerations? What are the things that we must begin to do? Please give us your thoughts and your advice on that. Thank you.
To be honest, I think where Prof ended is where this talk should end. I mean, he has said everything.
No.
I think we can just stop now, go to bed, think about this, and then come back later after we come up with plans. But I mean, just to give a very clear example of one of the things he said about creating that platform where this intersection, I know there was this Lagos Research and Development Council that was set up by the state government then, and the sole mandate of this platform was to award competitive grants for conducting research that would help the state to answer some of the critical policy questions that they had identified. And through that forum, findings from those research could be shared with the then governor, who was also in attendance on the, like a research day, for example, like what Professor Uneke had mentioned. And I believe such platforms, for example, just need to be instituted where there is a clear engagement between policy people and researchers. Maybe putting into action one of the things that Professor Uneke had mentioned about relationships. I think I'm going to do this. I will be setting up a new KPI for myself, which would be number of policymakers that are now my friends. I think that might be one sensible step to make. But on a serious note, I think that might be something that universities in Nigeria would need to explore, specifically beyond just counting the number of research outputs and publications, first author, second author, whatever author position that is of importance to the university. I think we also need to start looking at impact. What difference is the work that you are generating? How is that coming out for the community, for the society, for the betterment of the people, for the improvement of Nigeria as a whole? That I don't think we are doing enough with, and I think that's very important. In the UK, for example, there is the Research Excellence Framework that specifically tracks how your work has moved into impact and what difference is it making. I think this is something that we need to look forward, try to implement. And maybe this is a bit off the specific discourse, but I think one of the points that was raised earlier on was this unique opportunity that we now have with COVID-19 as a platform to kind of show that intersection, because really I don't think governments don't know exactly what needs to be done. Researchers are still trying to figure out what needs to be done. So if there was any point in time when that intersection was particularly critical, I think it is now. However, the general pathway of decision making moves from politics to policy, period. I think it has to be politics plus research leading to policy. But also, one thing you're beginning to see, even in the developed countries, COVID-19, is where the politics lead to the policy, but there's a pretense that there's an engagement with the research world, with the science, and everything is, we are following the best case science. I think just to flag to those who are working with the government also that the purpose of evidence is not to claim that you are using evidence. So yes, we are trying to set up this platform so that we can engage and work, but it should really be used for the purpose of improving the lives of people, of improving the lives of improving decision-making in our country. And I think if we can just achieve that, then we'll truly be on the pathway to evidence-based decision-making. Thank you very much.
Thank you, Dr. Adura. Thank you. One key thing that you said there that I took really note of, it's, as a researcher, what's the impact of your work? You talked about the Research Excellence Framework. I think it's something that we can begin to adapt for Nigeria. So it's not about research, it's not about how many publications you have, it's what is the impact of your work. Thank you so much. My question will go to Chinekwu Oreh. There's a question here for you. So we are trying to get the recommendations going forward. What do we think we need to do? You mentioned something that the kind of data that is most often available is really not the type that the politicians are in need of, So there's a question here from you, from Bolale Banigbe. What are the politicians doing? What are they doing and what can they do to institutionalize the availability of the type of data that we want? So we are trying to make recommendations going forward. So from the side of the policymakers, from the side of the politicians, what do you think can be done to close the gaps?
All right, thank you very much. I'll speak based on what we are currently doing. I work with the Nigerian Governors Forum Secretariat. So the Secretariat is the technical arm of the Nigeria Governors Forum. The forum brings together the 36 state governors. And what the Secretariat does is that it provides the technical support and administrative support to the forum. We help them with setting their priorities and agenda, and we try to engage with them based on evidence. So hitherto, we know, as our discussion has been showing, that a lot has not been done in this regard. And then what we have been doing is, first of all, we realize that there are a lot of data out there, but the data has not really been synthesized, and the data is not actually being utilized. Like what Dr. Adoura said, the essence of using evidence is not just for the sake of it. Like someone would say, we shouldn't be talking about policy-based evidence making, because sometimes what people do is that they have a policy that they want to drive and they try to look for evidence to back that policy, and that is not what it should be about. So what we have been doing is that we have identified that there is a need to translate data, evidence into decision making. So we actually came up with this theory of change, and what it's basically saying is this: there are a lot of data out there, but it's not available to the policymakers in the form that they understand and they can utilize. So we, on our own, developed a meta dashboard. And the meta dashboard basically draws relevant data from different data sources. Some are already existent, and sometimes we try to identify what we feel will be relevant. And we've had instances where we've had to work with people in the academia, people in research, to help us to gather data that we feel will be relevant to the policymakers, the decision makers in this regard, primarily the governors. So we have this meta dashboard and we pull together these different data. For example, with regards to budgeting, there's been a lot of issues around budgeting. People are always trying to request for more allocation to projects they feel is important. Well, then there isn't really any mechanism in place to track budgeting over time. And then, for example, we find out that the way the chart of accounts are across states is a bit difficult to tie budget allocations to programs. So with this observation, we try to engage with researchers in the field. We come up with what we think that we need, and we ask them to go into the field and get such data for us. So like I said, we have the meta dashboard where we synthesize the relevant data from different data sources, and then we come up with visualization tools, because like I said, it's very important that you understand your audience and ensure that whatever evidence is aligned to the audience. So we come up with data visualization tools, and we try to identify relevant communication channels. So what we do more or less bridges that gap. It's work in progress. We've been doing this for about 2 years plus now, and we've seen that we've had quite some significant wins with that. So we use different visualization tools based on existing data, or sometimes data that we commission to be retrieved on our behalf. And we use scorecards, state-specific briefs, one-on-one engagement, different platforms to engage with the policymakers. And contrary to what a lot of people think, they actually do listen. Like I have said before, I think that one of the major issues that we have had in the past is that, first of all, with regards to the academia, they were not doing relevant research. And what Professor Uneke is doing is very commendable, because I come from an academic background. I was a researcher for quite a while, and I knew that while I was a researcher, the default reaction to this kind of research is that it's not what you're supposed to be doing, because the researchers in the academia feel that you're supposed to be doing high-level research and things like that. But ultimately, the whole essence of research is to better the lot of the people. So what Professor Uneke is doing is actually quite commendable. So that has been an issue. quality of data or the relevance of data is not really what we want. And then the communication mechanism. So when we pull this data together, we develop relevant visualization tools, and we use different dissemination channels. One thing that I know that has really worked for us is the use of peer learning fora. For example, the Nigeria Governors Forum is one of such platforms. When they come together, because governors meet monthly, we always present relevant data with regards to whatever their agenda is. For example, the agenda now is universal health coverage with particular focus on strengthening health financing and strengthening the primary healthcare system. So we have identified, for example, the indicators that we feel that are relevant, and we develop very basic scorecards and all which we present to them. And I must say that we have made progress, because I know that, for example, when we started with the state health insurance program, which we felt was very important for financial protection, most states did not have anything with regards to their state health insurance schemes. But with consistent advocacy, providing evidence and showing them why it is important and what they have to do, we have recorded like 34 states or so that have passed the state health insurance law, and we have like 18 states that have started enrollment. And I must say that in the space of 2 years plus, about 2 years, we've had more enrollments on the state health insurance scheme than the national health insurance scheme that has been in existence for like 14 years. So one thing I know that contributed to that win was proper engagement. So like Professor Uneke said, there has to be that platform, and the peer learning platforms help. The commissioners of health, they have their fora as well, where they share experiences. And when we have some of these engagements, we actually invite resource persons from different sectors to speak to the things that we feel are important. So it's work in progress. And I want to also encourage other people in the Ministry of Health. These are things that could also be explored. You identify the data you feel that is relevant, try to pull it from where it currently is, and also try to engage with the academia to generate the data peradventure it is not available. Thank you very much.
Thank you. Thank you so much. Thank you so much. We have a lot of comments from the comment sections and a lot of chats. Maybe we just take some of the questions. Someone is asking a question here. I think this will go to Prof. Uneke. How can we advocate for a turnaround, for funding process for universities from the way it is currently structured to research and scholarship driven? I would want to add to that, how can we institutionalize really what you have started from, your university and make it like, a standard across the universities? What recommendations, Prof, do you have to change the way universities are currently run and managed in terms of their research and funding,
All right, thank you very much. That's an interesting question. What do we do to improve the process of the funding for research in the university? Well, the main thing here is that we don't even have enough local research funding opportunities. For even health policy and systems research. Most of the research we have in the health sector are related to biomedical research. And that's where majority of the research is going into. But I'm glad to inform you that recently in the third fund revised guideline for institutional based research and national research based, the one that is of course national research based, they have also introduced policy and systems research in it. Though it's not standing alone, it's part of the general health research. So I'm happy seeing it there, because what it shows is that there is a recognition of this at the national level, and it's quite exciting. I have said something in a number of meetings at the national level and even at the state level. And I'm sure some individuals got to hear about it or heard it, but we'll still continue to push it. There is an agency of the federal government that gives us out research funding substantially, and that is HERFON. And what I was pushing is that ministries in the country should liaise with HERFON so that they can provide to HERFON their specific areas of need yearly. What we have in the HERFON document is broad areas of focus, but it is not tailored specifically to the yearly context or need. That, for instance, you make your budget, you have areas you want to focus in each year. What I am looking at is a situation where, for instance, the Ministry of Health will write to HERFON and say, in this year 2021, these are the areas that we're interested in focusing health interventions. These are our priority areas. Can you please use those areas and put it into the HERFON guideline so that when HERFON is issuing out a call, the call in the health sector is very, very relevant to the Ministry of Health. We cannot be having generic top line because those areas are particular year. So ministries need to rise up to the occasion. And that's why we are seriously emphasizing intersectoral collaboration. I see a lot of silos everywhere. I've seen a lot of things with the way ministries work, and it's not really the best. They work so much in isolation. But it's time to start coming together. Okay, Ministry of Health does not award research grants, but HERFON awards. And both HERFON and Ministry of Health are under the same government. Why can't they, find a way of working together so that the Ministry of Health supplies the areas of priority interest to HERFON? HERFON issues it as a call to the universities so that when people do research in the university and the findings are submitted to HERFON, HERFON will forward it to the Ministry of Health. That's one of the ways we can, bridge this serious divide between research and policy and practice process in Nigeria. Because HERFON awards, there's a lot of money for research. In the last few months, there was a call that the President, His Excellency Muhammad Buhari, approved 7 billion for research for HERFON. And calls were made for people to submit research proposals. But what I was trying to say now is that is an opportunity that all the ministries could cash on and send to HERFON the areas that they are interested in, so that HERFON will tailor the research to make sure that the researchers do it within those areas. Normally, if you are writing a proposal, you stay within the area of the call if you are interested in getting it. So that's one of the way of also, compelling researchers to do projects that are relevant to our society. So that's one area that could be done. Another area that can improve funding. Listen to me, I'm talking to all the researchers now. You need to invest on yourself to improve your capacity for grantsmanship. You need to invest. You need to improve your capacity to access research grants. The grants that I managed to use to start off the whole initiative of health policy and health systems in Nigeria, they came from international competitive grants. I competed for it because I built the capacity for it. And I competed and I got a number of them. And that was what I used to start building, the whole process of evidence to policy process from my institution. So people should go and also learn to invest some of their resources, improving their capacity. Attend meetings where grantsmanship is taught, because there are so many funding opportunities out there. What we don't have is the capacity to also compete for them. So I'm advising every researcher that is listening to me, especially the younger ones, don't stay and depend on your salary. You can't use your salary to do research. It's not even enough for you. So how can you use your salary to do any meaningful research? And even when you publish a paper and then they look at funding and discover that you didn't receive any funding for the research, it's very difficult for you to convince people that that research was really, credibly done. Because everybody knows that, like one of the panelists said, that research costs money. So you need to learn, to compete for them so that you can get them. And let me say something. The international community doesn't care where you are coming from, who you are, at any level you are coming from, as long as you have something to offer the world. By the time I was able to get my first WHO major grant, I hadn't even defended my PhD. So I competed with a lot of people who were academically higher than me, but because I had the skill that superseded their own, I got the grant and they didn't get it. So don't stay there and you are complaining that there is no grant. Just go and type in Google, type calls for proposal, put health there and put 2020. You will be shocked at the amount of money waiting out there for you to compete for. So we need to build capacity. Please invest in grantsmanship as a young academic. It will help you a lot. By the time you start building up and you start getting grants, you will notice that you accelerate fast in the university. That was what helped me. If you are assessing research grants and writing projects and then publishing funded research work, before you know what is happening, you'll be noticed everywhere in the world. And that's one of the things that I want to request that every one of us should do. And this, for now, those are the two areas that I think that are very, very feasible for us, until we get to a stage where the improvement of funding in the university will be highly better than what we are seeing it today. Until then, these are the only two ways I think that we can still be able to access some funding and carry out some research. Thank you very much.
Thank you so much, Prof. Thank you so much, Prof. You said
something. Yes, let me say something so that I don't forget. One of our colleagues, I think is Chinekwu. Thank you very much. You made a very important statement, and I want to just comment briefly on that. You see, another problem with we, the researchers, is that we don't even know how to present information to the policymakers. Is in fact, one of the most difficult things that you can ask a researcher to do is to write a plain language abstract. It's a challenge. We love to write. We love words. We love a lot of words because you feel you are expressing yourself in your academic space when you write so much. What people may not even understand, but tell somebody to write in plain language. That is one of the most challenging aspects of academics. If you tell somebody your project that is 100 pages, put an abstract of 100 words. That's a big challenge. But that's one of the areas we also need to learn, skill. You need to learn to be able to tailor a lot of information to a very simple format that the busy policymaker can easily understand. And that's why we talk about policy briefs. Everybody should learn how to write policy briefs because policy briefs will give the busy a chief executive, either a governor or a minister or a director in the ministry, bullet points of the issues where the person needs to take decision. You don't need to start doing complex statistical analysis that is not relevant to the man or woman. He doesn't have time. He has only maybe 10 minutes. And that 10 minutes, he should be able to look at a document, identify the key things, and take management or administrative decision. So let's also understand that when we are presenting information to the governors, to the ministers, to the directors, we should understand that these people may not be specialists. I don't know how many of the governors have PhDs. I don't know how many of the governors are professors. Even if they are professors, they may be professor of law, not professor of health. So you need to learn how to present policy briefs. There is an experience I had with our governor in my state. There is one of the projects that you know, we are working together with him. And each time we go to him, he needs only 1 page. He'll tell you, go and put, you have your big document, go and put it in 1 page. So you are now learned that, you know, when you are meeting with chief executives like governors, they don't need more than a page. If you have to learn how to put your evidence, put your recommendations in 1 page in a tabular form, and let him see it, or let her see it, let the person, whoever that is in charge, see it very clearly at a glance, and then be able to take a decision. And we, the researchers, need to learn this. When Chinekwu was talking, I was so excited, and I'm happy that you are coming from the governors forum. And let everybody hear this, that we need to learn how to go and translate you know, the evidence we have generated into plain language, into format that the busy and non-specialist policymaker will be able to look at, and within a shortest period of time, take an administrative or executive decision. Thank you very much.
Thank you so much, Prof, for all you have said. We'll go now to Dr. Azodoh. Dr. Azodoh, sorry, we have kept you on hold for a while now. Yeah, so you know, we're trying to really round up the discussion by really generating action point for the next phase. You know, if we must close these gaps, what are the key recommendations? What key considerations, you know, would you want to recommend, both from the side of the researchers, from the side of the policymakers? What must we do to close this gap? Thank you so much. You have the floor.
Thank you very much. Let me acknowledge the presence of the Honorable Minister of State for Health on this platform. Distinguished Senator Dr. Mamora is online. Good morning, sir. And just to respond to the issues, I really appreciate Professor Jesse Uneke. Prof, well done. You are just an encyclopedia of information, and I want to request that we interface after this meeting. I'll ask Rita for your number, and then I can call you and we take it from there. Having said that, and having listened to Prof and all his enormous contributions, I think one of the things we also must do is to formalize the platform for engagement. While it is good to have informal relationships, you really can't break the law if you refuse to, you know, implement something that has been agreed in an informal basis. While you may breach trust, you haven't broken the law, so you will not be held accountable. So I think in order to help people who are working, both researchers in the university and the policymakers need to have a formalized relationship. You know, so we may be looking at Prof, and this is something we should be looking at from the classroom to the, well, I don't know what we'll call it, from the classroom to the to policy, from classroom to the policy. So we can have a structured way of engaging the research, so that once a research has been conducted, it should naturally follow a particular process of either being sent to the Ministry of Health or Ministry of Education, you know, just by way of recording. And then the ministry will be required to acknowledge and acknowledge receipts and with it. So that way we can hold everybody accountable. The platform of the National Council on Health is also a very good platform where researchers and policymakers can come together. So we also should be looking at a situation where we move our research opportunities, you know, into the National Council on Health. And that again entails engaging the relevant platform in the Ministry of Health where we work, you know. And then I think that the issue of exchange program is very critical. I started recently, I applied to go and lecture in one of my colleagues who is the vice chancellor. Now I had, you know, approached him that I want to go and share I've been in policy and planning for close to 30 years in the ministry, so well, over 20 years. So and I now said, well, why not? So that a platform to engage policymakers, and for policymakers to be to engage professors and the academia is very important. So what the university can also be looking at, if you have all this experience, how do you translate that into well, a certification or a degree? You know, I know that some of the courses that I did in one of the universities abroad, they evaluated my work and say, okay, madam, I had actually applied to do another master's. They said, no, you cannot do a master's. This is where we place you. So we need you to do a PhD in so, and so. So we also must look at how the academia can engage the policymakers, you know, because sometimes a lot of what we know will be very useful to the policymakers. Going back to the National Secretary of the committee that drafted the national boss letter, there were a lot of experiences that we drew from that, and that's why it's so sad that Senator lessons we learned. It's important to continue to engage our researchers, the university, the academia. A lot of the issues that went into the development of the National Health Act were already in existence in one form or the other. What we actually did was, okay, do it and take it from there. So I think that there's a lot that is already in existence. What we need to do is to now engage our academia appropriately. And I think that we need to walk through looking at the ethics committee, to walk through the membership of those committees in a way that we cannot begin to use professors in the ethics committee the last time I checked, but we need to now rethink the workings of the ethics committee in such a way, without killing the ability of people to just become groundbreaking findings. They have been useless or looked useless at the time they were being investigated by researchers. So without killing innovation and all that, we also must begin to look at the ethics committee. What are their requirements? Does it include asking how this is relevant to policy? And if it does, how does the ethics committee engage the government that has established them to ensure that, okay, this has been, findings have taken place, this research taking place. These are the findings. How are you as government taking that on? Because it's not enough. We also must ask government through the ethics committee to show how they are utilizing the findings of the researchers. It must be a two-way thing. And then, you know, those kinds of things should be important. Then the issue of participation in programs, I think that we talked about engagement, you know, collaboration and engagement between the policymakers and the researchers, and we need to formalize some of those platforms because they're important and they're critical. And finally, I want to appreciate I don't know why I have so much cold. Finally, I want to appreciate the organizers for this, for organizing this meeting. I think it's been very, very critical and very useful. I also think that we should actually be looking at a post-COVID health sector and research. We also must engage that throughout the rest of the day, because we can't finish this and talk in what was the Prof used now, you know, like talk in the classroom style without the practicality of it. We also need to be looking at what does this research mean for us in the post-COVID health sector. We can't run away from it. From the publications of the Nigerian Bureau of Statistics on the 24th, which is Monday, we already know that our GDP is down to -6 point whatever. So that is, we are running a negative economy. And that has a lot of implications for the health sector, any which way we look at it. So in going forward, we also must now begin to look at how can research help us in a post-COVID health sector? How can we engage other sectors appropriately? How can we engage other sectors usefully? How can we engage other sectors without further destroying a very weak health system? And how can we actually build back better? How can we have a post-COVID, more resilient health system? Thank you very much, and God bless all of us. Good morning.
Thank you so much, Dr. Azodoh. Thank you so much. You said, I took, notes of the points that, you said. One thing you said very strongly is that formalized relationship between policymakers and researchers is key. The question I may have is, how do we formalize this relationship? Whose responsibility is it? Some of these discussions mentioned yesterday, and one of the challenges, that one of the panelists presented was the fact that NIMA, it's more focused on medical research. There is need to create an arm for HSPR within NIMA. So, in thinking around formalizing this relationship, we need to think about who is the responsible institutions to take the lead in, to formalize that relationship. And then exchange programs are very critical. That came out yesterday. And then Prof just gave us a very, on the comment box that, someone said that's very sexy, that the gown must meet the town, So there is need to strengthen exchange programs between academia and policymakers. I also take that as an action point for us in the developmental sector. We have done well in terms of strengthening our relationship with the policymakers, but our weakness is really has, been to extend that relationship also to the researchers or the academia, so that's an action point for me to take back, that we must bridge that gap. And then Dr. Azodoh, there is a breakout section later in the evening that will be focused on COVID, enhancing the opportunities that COVID presents to us to strengthen our health system. So, it'd be nice to have you in that breakout discussion to really get your insights, with regards to that matter. So there's a lot of comments and recommendations, from the box. I will just read, a few of them just to shed more light to, the key points that have been raised today. One of it here is that policy brief, in summary, simple infographics are key when you are sharing your research findings to policymakers. Exchange programs between academia and policymakers are important. Dr. Azodoh, that was a comment. And then researchers need to learn to translate and put evidence into plain languages. Yes. Okay, special appreciation to all panelists. Yeah, so it's been very insightful. So just before we close, if any of our panelists have, any contribution to make, if there's anything that you think you want to contribute to the ongoing discussion, please, you have the floor. And also our audience, also, if you have any question or contribution, let us know. If you want a voice in and you want to be enabled to make a contribution, please use the chat box and let us know, and you'll be enabled so you can, add to the conversations. And importantly, we are not ending. We are continuing these conversations. Please use your Twitter, tweet the points that you have learned today. Let's carry on these conversations. One thing is important that I've gotten from here is the fact that this convening is very helpful, and we are hopeful that major outputs, will come out of this convening, and there is need that we make this convening an annual thing where we come together and review process and progress and re-strategize and share experiences, Yeah, so thank you so much. Any of our panelists, any more contribution?
Rita, thank you. Thank you. You asked a question. Can I?
Yeah.
You asked a question. You said, how do we formalize this relationship? Which who is the responsible agency or organization. Now, first and foremost, thank you again for all your kind and very nice words and all the comments. The Federal Ministry of Health has the Minister of State for Health drives the research agenda of government in the health sector. He's a very engaging and engaged person and very cerebral also. So I think one of the things we should do is to submit the report of this meeting to him with specific prayers arising from the recommendation, and he would know what to do. But I think he will now formalize this report of this meeting through the National Council on Health. Once the minister approves it, it becomes a policy. But to make it more binding, he would take it to the National Council on Health, and then the National Council on Health would then review it, working with HERFON and everybody else, and then maybe we can have Prof come and stand on the floor of the council and make such wonderful presentation. And once that approved, it becomes implementation will start. People will be at various levels, but there is a research division in the Department of Health Planning, Research and Statistics, which is where the ethics committee is also. They would engage, or find opportunity to engage them, and also they would now also have a template to monitor the implementation of the tracking of the implementation of the outcome of the approvals around research. So I think that the right part, we have the Minister of State, we have the ministers, and then we can engage the Department of Health Planning, Research and Statistics, and we can then have, all the inputs. And it's a doable thing, really. It's difficult, but the good thing about a difficult situation is that it creates opportunity, because everybody is looking for a better exit strategy, to exit from the difficulty. So yes, it's done. And we, being a panelist on this and being a staff of the Federal Ministry of Health, I think I also want to offer my availability to work with the team and the Minister of State to take the outcome of this meeting forward, okay, so that we can walk through that and get the Minister of State to engage with the outcome, and then review it and send it to the National Council on Health, or as the minister directs. But at least the minister will get it. The Minister of State, which drives policy, research policy in the ministry, will get it. That I can assure you.
Thank you so much, Dr. Azodoh. Thank you so much for your play.
Okay. Hello, Rita.
Yes, Prof.
Yes. I have another meeting I wanted to rush to, but I thought I should stay back and listen to Dr. Azodoh. So, Dr. Azodoh, thanks a lot. The concluding statement you made is, in fact, very powerful, and I appreciate that. I love to see words translated into action. I guess the working in the evidence to policy space has made me more of an action person. I get impatient when words are accumulated and no action follows. So I'm excited with that. I'm happy I didn't leave before your statement. So thank you very much, Dr. Azodoh. Like you said, we'll get in touch and see how we can also contribute in our own little way to see how things can move forward. Thank you very much. And then to the organizers, thank you. I have to leave now. Thank you to everyone who has made out time to listen to us. Please take this home with you or back to your working place. Please translate word into action. If I have a way of monitoring to ensure that each of you will put these things you have had into action, I would have done that. But please do us a favor, do Nigeria a favor by taking the knowledge you have acquired in this session and try your best to translate it into action. It will help us a lot to move our health systems forward. Thank you very much, and God bless everyone. I'll be leaving now. I have another meeting. Thank you very much.
Okay, thank you so much, Prof. Thank you so much for the stimulating conversation. So, wow. So it's been an engaging last 2 hours. Thanks so much to all our audience, for your patience and for your time. I'm sure you've all been engaged. And to our panelists also, I mean, just before we wrap up this section, maybe just one word. Prof. Uneke has left off with one word. Knowledge must be translated into action. Dr. Adura gave us already his KPI, that he's going back to, asking how many policy makers does he have contact with. So for everyone, I mean, what will be your action point going forward? What are you taking on from this? Okay. Yeah, so just one word and then we'll wrap up and continue the next section. Maybe Dr. Adura, if you're still on, I mean, one word, what do you have to tell us in just one word or one sentence so we can wrap up and continue the next session immediately?
Yeah, no, I think you've said the right thing, which is we need to go out now and get the work done. Looking forward to establishing those relationships and looking forward to pushing forward with the work that we need to do to improve health systems outcomes. So thank you very much for having me. It was an absolute pleasure to be here, and we need more forums like this. Thank you to you and to all the organizers.
Thank you so much.
Thank you.
Thank you. Yeah, Chinekwu, Oreh, any word for us as we leave?
Yeah, first of all, I want to appreciate you for putting this together, and I'm grateful I was part of this panel. And like Professor Uneke said, I just want to echo it. There's been a lot of talk in the past, but this is time to move from talking to action. So I hope that the organizers probably have come up with a framework for tracking the progress following these engagements to see the impact that it will have in this space going forward. So thank you very much. And we look forward to more engagements with your team. Thank you.
Thank you. Sure, we will reach out to you. And Dr. Azodoh? Dr. Azodoh, do we have you still? Okay, I think she's muted. Dr. Azodoh, can you hear us? Okay, just a word for us, and then we'll wrap up the section and continue the next section immediately. Okay. You're muted. If you're talking, you're muted. We can't hear you. Wow, we can. I think our network bandwidth is low. So thank you, everyone. It's been an engaging 2 hours. We are continuing the next section immediately. Please just hang on and then continue on Twitter. Someone asked a question, how can we get recording? So this is being streamed live on Facebook, so you can watch the replay after this. Thank you.
Okay, thank you everyone that joined that session. Thanks to all our wonderful panelists for the very engaging and insightful session. We'll be going straight to the next session, which is putting people at the center of health. And we have putting people at the center of health, the health system and policy making in Nigeria. And this promises to be a very equally exciting and engaging session. We have a beautiful lineup of panelists who are seasoned experts in their areas of expertise. The session will be moderated by Vanessa, Adie, Offiong. And as a way of brief introduction, for those that are just joining, this convening has been put together by HSG, the African region, and it's strengthening capacity for health policy and system research in Nigeria. I'll just give a brief overview, just to bring everybody up to speed. HSG started in 2012 and is a growing membership organization of researchers, decision makers, and implementers who are dedicated to promoting HPSR and knowledge generation. Its vision is to support health systems to attain better health, equity, and well-being by strengthening health policy and systems research, policy and practice communities. While its mission is to connect and engage researchers, policymakers, healthcare managers, educators, civil society, media, and donors to build collective capacity for generating, sharing, and applying knowledge necessary for health system strengthening. And if you all agree with me, this is what we've been doing over the past 2 days. So HSG has regional networks. It has a membership of more than 1,600 members in over 110 countries. And the regional network provides these kind of opportunities for interaction and knowledge sharing. So this convening is an initiative of the HSG Africa Regional Network in collaboration with the Systems Development Initiative, an organization founded in 2020. It's a platform dedicated to promoting evidence-informed health and development policies in Nigeria and beyond. And these are the members of this group. In addition, we collaborated with 2 other organizations, NISA, the Nigerian Implementation Science Alliance, which started as a collaboration amongst United States PEPFAR-supported implementing partners, research universities, and policymakers to enhance the quality of healthcare through implementation science and research. And then HERFON. HERFON has been around for a long time. It's the Health Reform Foundation of Nigeria, a non-profit organization dedicated to addressing and improving poor health indices in Nigeria. So I'll go on briefly to introduce the panelists for this session. As Dr. Azodoh mentioned, we have a very special guest who is already online. So like I mentioned earlier, the moderator for this session is Vanessa Adie. She's an award-winning journalist in Abuja, Nigeria, with experience in investigative science and development journalism. She's a member of Health Systems Global, the Center for Collaborative Investigative Journalism, and a member of the African Investigative Publishing Collective. She won the Journalist of the Year Award and was the only female finalist of the 2019 Continental Journalism Awards. We have with us the distinguished Senator Dr. Olorunimbe Adeleke Mamora, who is the Honorable Minister of State for Health. He was elected Senator of the Lagos East constituency of Lagos State, Nigeria, taking office on 29 May 2007. He's a member of the APC and was a national delegate for the National Republican Convention in 1990. Currently, he's the Minister of State, the Honorable Minister of State for Health. He sponsored or co-sponsored motions, including one to amend Senate Rule 111 to bring into conformity with the Constitution of the Federal Republic of Nigeria. He was described as a master of parliamentary procedures. Our next panelist is Bishop Matthew Hassan Kuka. He's the Bishop of the Catholic Diocese of Sokoto, Nigeria. He was born on August 31, 1952 in Zangon, Kataf, local government area of Kaduna State. He received his primary education at St. Fidelis Primary School and then proceeded to St. Joseph's Minor Seminary, Zaria, before he proceeded to St. Augustine's Major Seminary, Jos, Plateau State, where he studied philosophy and theology. Between 1999 and 2001, he served as a member of the Nigerian Investigation Commission of Human Rights Violations, in addition to his work as a parish priest of St. Andrew's Parish in Kakura, Kaduna. From 2004 until his nomination as bishop, he was the secretary of the National Political Reform Conference, and from 2005 onwards, he has been serving as the chairman of the Ogonishel Reconciliation. Additionally, between 2007 and 2009, He worked also in the Committee for Electoral Reform set up by the Nigerian government. Currently, he's the Bishop of the Catholic Diocese of Sokoto. Our last but least speaker is Yemi Ademolaku, the Executive Director, Enough is Enough. This is a non-partisan network of individuals and organizations committed to building a culture of good governance and public accountability in Nigeria through active citizenship. Enough is Enough has led various advocacy campaigns, including its flagship RSVP, Register, Select, Vote, and Protect campaign, promoting voter education and participation. It's also involved in the Open NAS campaign, calling for the accountability and transparency in the National Assembly. EIE continues to be actively involved in the Bring Back Our Girls campaign, calling for the government to find and rescue the Chibok girls. Yemi has a 22-year diverse career spanning the public and private sectors in the US and Nigeria. She volunteers for Kalayawa House, an NGO founded by her late mother focused on the elderly. She was named as one of the most influential people of African descent, endorsed by the United Nations in the humanitarian and religious category. If you will agree with me, as I mentioned earlier, we have a seasoned set of panelists. So with this, I welcome the moderator, Vanessa Offiong, to take over this session. Thank you.
Thank you very much, Kasarachi, and thank you, everyone. It's nice to have you all here join us. I would like to apologize that we had to reschedule and start a little later. We're very sorry for the inconveniences that this would have caused. And then we're grateful to everyone for being amenable to the timing. I would like to start by posing my question to the Honorable Minister of State. Thank you very much, sir, for accepting to be a part of this conversation. And I would like to start by asking you, what mechanisms are in place to ensure grassroots participation in policy making in health in Nigeria? Hello? Hello? Hello?
He's muted, so let's unmute him.
Okay, please, can somebody do that?
They have access. Bishop Cooker has been unmuted, so you can please join.
Okay,
then
please.
Senator Mamora too, please. We can just be ensured that he's on seat. Thank you.
Okay, I already started posing the questions. I'm not sure if Senator Mamora heard me. Welcome, Your Lordship.
Yeah, thank you very much, Vanessa. Hello, Kasarachi, if I hope I pronounce it right. Hello, everybody.
Sir.
Good to be here.
Okay, thank you. Hello, can the Honorable Minister hear me?
He is unmuted.
Hello?
He is unmuted.
So, does it mean he can hear? Okay, so maybe while we resolve that, could we ask His Lordship, can you hear me?
Yeah, you very well.
Okay, so let me start with you while we resolve the audio with the Honorable Minister. I would like to ask you, I mean, the Catholic Church has played a profound role in terms of health systems and structure in Nigeria. And I would like to ask you what that experience has been like. You know, you're the Bishop of the Catholic Diocese of Sokoto, and we've seen reports of interventions that you've carried out for grassroots and communities around Sokoto and beyond. Could you please share with us what that experience has been like?
Well, thank you very much. I think that this question is more or less directly related to the first question you posed, which I thought was an interesting question, because question of where we place people in policy. And it has always been the belief of the Catholic Church that at the center of human life and human development is the human person at every level. And I think that the great thing that we have as a Catholic Church, which is why we are called Catholic. Catholic is not a denomination, it's an expression of our universality. So we believe and take inspiration from what Jesus himself said, I have come that you may have life and have it to the full. And we believe that a full life is not attainable by just administering sacraments and converting people. And this is what has informed our policy of intervention in human care at all levels. So here in Sokoto, our numbers are not very large, but I think we've also made quite significant impact. We have a small medical facility, which is characteristic of all our medical facilities, that very often the people that come to us are people that cannot afford to access medical help elsewhere. And I think this has been our strength. It has also been a problem largely because of the very limited, if at all, in many cases, almost existent support that we get from government. So it's been an enriching experience, but I think the great thing for us is to just see people's lives and the quality of their lives changing as a result of our interventions. And this is why almost everywhere, every diocese in Nigeria has a health facility, no matter how poor that diocese may be. So this is really a very important part of our evangelization.
Okay, thank you very much, Your Lordship. Are we able to reach the minister now? Okay, so in achieving these targets, what's been the major challenge that you've had to overcome or surmount, especially with maybe funding or for the people who need to get these interventions to get them?
I think that, it's a very good question, but it also speaks to the nature of the priorities or lack of priorities set by government. And it is that the history of Nigeria is a history of the failure of government, almost in many places, total and absolute failure of government to intervene in ways and manners that place the survival of human beings over and above every other thing. The persistence of hunger, the terrible human survival indices that manifest across this country. So just very clearly that there is an urgent need for policy reversal. And I think this is why an initiative such as the one you are undertaking, by trying to connect the effort of research with public policy, is so significant and so important. But ordinarily, Catholic hospitals, Catholic schools don't treat only Catholics. They don't, in fact, in many cases, especially given where I am, over 70–80% of those that we administer to are Muslims. They're not members of our churches, even when they are Christians. But this is not something that is a priority to us. Our priority is human existence and human survival. The tragedy is that in this country, religion has come to be seen in a completely different light altogether from the point of identity. And so the suggestion more or less is that religion is more or less something that functions outside the mainstream life of society. And this is why you find that there is very little interest and support for some of the wonderful work that faith-based communities are undertaking. And here I speak of the Christian community because one is the one that I'm most familiar with, and two, perhaps we are the only faith organization that is openly involved in these initiatives, education, health, well outside our immediate constituencies. So in a much more serious society, the state would naturally be deliberate in formulating policy that help to enhance collaboration, between the church and the state in meeting the needs of ordinary people, whether it is in education or in health. And here, of course, I give credit to states like Anambra, Imo, and some of the states in the South. We are very clearly, the state has realized that it is saving far more resources by collaborating with the churches in delivering health services. It is saving far more resources by delivering services in the area of education in collaboration with the health community. So frankly, the point to make is that we are the system to be less corrupt. Partnership between church and state would make Nigerians much better off in many respects. So I think the most critical thing is the need for closer collaboration and partnership, because we are dealing with the issues of the survival of human beings who happen to be Nigerians.
Okay, so are you at some point collaborating with government? Are you getting funding from government, or how? I mean, how do you as a Catholic Church manage this process?
Sorry, please come again.
Okay, I'm asking if you're getting funding from government and or you're getting some kind of support or collaboration with them. How are you managing?
We have not had any support or collaboration directly from government. However, I can say that in the Diocese of Sokoto, we have a very decent ambulance, but that ambulance was a donation from the governor of Delta State, Emmanuel Oduagan, who came and saw what we are trying to do and appreciated it. As I said, the very unfortunate thing in many parts of northern Nigeria and across the country is that people have tended to see religious bodies as outside actors. And in an environment where people take religion so seriously, people mistakenly think that if you were to support the Catholic Church, for example, by providing areas of collaboration, whether it is even in the construction of infrastructure, whether they be classrooms or whatever, that you are supporting the church. The opposite is actually the case. In Katsina State, for example, the governor actually appreciated the effort we are making in the area of education and offered, and he did actually buy a bus for us. So these are the kind of areas of collaboration that we want. But unfortunately, as I said, the environment is so saturated with religion and religious prejudices that people think that for you to be partnering with let's say, and of course, if you take it right across outside Christianity, if you are Catholic and you are partnering with the Anglicans or the Baptists or whatever, that you are supporting that church. In reality, as I said, our focus should really be on the survival of our people, because that is where we should place, our priority. So we would like to see greater collaboration, greater conversation, and I'm hopeful that a conversation of this nature should help to open up, clear many doubts as to how this collaboration can be undertaken within the most transparent way and manner, in such a way that ordinary people are the beneficiaries of services that we're trying to offer.
Okay, thank you very much, my lord. It seems Senator Mamora has been able to join us. Am I right? Okay, that doesn't seem to have been resolved. I'm sorry, my lord, you seem to be the star of the moment at this time, so we'll exploit it and ask you some more questions. But you've said that you've not received any support from government, and the one that as a diocese that you've received came from the former governor of Delta State, Dr. Emmanuel Oduagan. But I'd like to ask, have you also made an attempt to reach out to government to maybe say, this is what we're doing as a Catholic Church, this is where we would like you to come in, and have they said no to you, or have they said yes and not fulfilled their promise?
I'm sorry, I missed almost everything you said. The only thing I had was promise.
Okay, so I was asking that you have said that you have not received any support from government, but I would like to ask you, as a church, have you reached out to government for support? Have you made known the effort you've made to intervene at the community level for better healthcare service, and they haven't responded, or they have not responded, or they have responded saying yes, but not actually fulfilled their promise?
Well, I mean, I give you a simple example. The previous government of Sokoto State is quite aware of the effort that we made. In fact, the day that we dedicated our clinic, His Eminence the Sultan was with us. He cut the tape, along with the governor. With the governor of Delta State, who flew all the way from Delta to be with us. Very unfortunately for us, the governor on the ground promised that he was going to be with us, but at the end, he didn't make an appearance. We had approached them, asking them for help. That help didn't come. But I don't hold that as a grudge. I just think that, well, for now, we have not opened up formally this conversation again. Largely in part because, as I said, that there's really a lot that needs to be done. The Catholic Church is not going to write an application, for example, saying, please, can we be considered for this, that, or the other? But our staff are constantly in touch with the Ministry of Health. The government is not unaware of our presence. And as I said, I really would like to see that in designing and formulating policy, that government deliberately and consciously appreciates the fact that the churches have far more reach, the mosques have far more reach than the politicians themselves. And I think this is what the President George Bush, the late President Bush, realized way back in the mid-80s when, as president, he decided to open up, the areas of collaboration, with the churches. That is still so in America today, where, and Trump has even gone a bit further in this regard. That everywhere in the world, people now realize that from the point of view of getting results, that is assuming politicians are serious and honest about wanting to get results, were you to speak to the government of Anambra State or speak to somebody like Peter Obi, he would tell you, for example, that they were saving costs by almost up to 50% by asking the churches either to help build hospitals or build schools. And they discovered that the system and the process was much more transparent, much more honest. So really, I'm saying that this collaboration needs to be incorporated into our policy so that this conversation can be given better traction. And this is something that I believe the National Assembly can and should consider in its conversation going forward. Because the churches have better infrastructure, they have pretty well-trained personnel, and they already have existing templates. Because in almost all the dioceses in Nigeria today, if you go to Kaduna State, for example, the whole of Kaduna State, the reference point, medical reference point is St. Gerard's Hospital. St. Gerard's Hospital was built over 60 years ago because they celebrated their 60th anniversary 2 years ago. In many cases, in Abeokuta, in the East, and so on, Catholic health facilities came into existence before independence. So, and many people will tell you that a significant percentage of the elite in many of these communities, if you go to Kaduna, for example, most of the children of the elite, some of them in their 40s and 50s, were born in St. Gerard's Hospital. So people know of this. The only thing is, as I said, the failure of policy, the suspicion that people continue to have about religion and so on. But clearly, for us to be much more efficient and to be able to reach the ordinary people on the grassroots, the state needs to deliberately plan to integrate the faith communities into its administration in the area of health.
Okay, when you advocate for more incorporation of the faith into administration, what would you say about how much it makes an effort with making its policies, its health policies, people-centered and people involving, up to the grassroots level? What would you say about that?
I give you an example. I was chairman of St. Gerard's Hospital in Kaduna. And in St. Gerard, just like in most of our health facilities, we discovered that a good number of people occasionally were disappearing at 5 o'clock in the morning or on godly hours of the morning with their patients, especially women who had put to bed, largely because the poor felt they didn't want to face the embarrassment of their people being held back because they couldn't afford to pay the medical bills. We took care of this by developing a fund which has been in existence, for example, in St. Gerard's. We have even to a lesser or greater extent here, where people the church never holds back services to you on grounds of your inability to pay. It's not to say that we're administering health services for free, but that it is survival of the human being that is most important. So I think that the point to be made is that I think you were at the event yourself, or you reported the event when we decided here to have an open clinic, just for for ordinary people. People traveled from as far away as Niger State when they heard about this event, and it was just 2 days to the event itself. And you would have seen the smile on the faces of ordinary people. And we're dealing with sick people. We weren't dealing with Muslims. We weren't dealing with women. We weren't dealing with religion. We weren't dealing with gender. We're just dealing with people who were just accidentally Christian or Muslim, male or female, who needed attention. And they got that attention. Now, with a little bit of support, as I said, from government, those kind of things can be done much more effectively and much more efficiently. Because as I said, the churches are literal. I mean, you saw the report in our approach to what do you call them, to the CDC, to say, I mean, is it CNC, to say that we were offering the National Technical Committee on COVID-19, the Catholic Church was offering its 465 hospitals spread across the country. That tells you, for example, there are 57 dioceses in Nigeria. If you divide that number of hospitals by the dioceses, you can imagine how many hospitals every diocese has. So from the point of view of reach, that is really the least problem for the church. And we're just dealing with the Catholic Church. We're not talking about the Anglican Church, the Baptist Church, and and a range of other churches. So really, finally, it is in the interest of government, assuming for the sake of argument that government is serious in its commitment to meet the health needs or even the educational needs of ordinary people in Nigeria. But part of the tragedy, is that people see more the contracts, people see more the corruption, people see more the opportunity for self-enrichment. And that's why government is sinking hundreds of billions of dollars and naira, and we're still not able, we're still in darkness. Our people, as Abacha said in 1983, our hospitals are still mere consulting clinics. Things have even gotten progressively worse. But the budget lines have actually continued to increase, but we're not getting any results. So frankly, it is not about religion. It's about honesty, integrity, and trust. That if government is really serious about offering health services to ordinary Nigerians, it must collaborate with non-state actors.
Yeah, but would you say that it has sufficiently made an effort to put the people who benefit from its policies in the decision-making process of those policies?
Well, the truth of the matter, the answer to that is no. And it comes purely and simply from the way that Africans understand politics and Nigerian politicians understand politics and power. They prefer to have power over, not power to. So power over others, power over resources, but not power to horizontally address the issues of the needs of ordinary citizens. So, and this is why we have a political system structure that does not even begin to address the needs of ordinary people, even in terms of their political choices, which is why you see that I'm happy. I hope that my friend and brother, Senator Mamora, will finally still come on stage. But this is why you have a situation in which people are genuinely concerned about huge resources being distributed in the National Assembly, and yet people are really not, seriously speaking, in touch with their constituencies, so-called. And that there is the only conversation that ordinary people have with their politicians is when they fly in to collect, steal, or beg for votes, and then they never come back again until the next election. So the truth of the matter is that the Nigerian political class is totally and absolutely disconnected from the welfare and the well-being of ordinary people. For me, this is really at the center of the problem.
A role in ensuring that they're part of this process?
Well, I mean, the truth of the matter is that if you have power, the average politician feels intimidated by ordinary people because they also know when you have the saying, the voice of the people is the voice of God. People holding illegitimate mandates don't want to have to confront the reality of the anger or the wrath of ordinary people. So, and this is why in many of our communities, especially in northern Nigeria, governors, successive governments have never taken the issue of education seriously. Because they also know the revolutionary impact of religion, but they also know the advantage that they benefit from keeping people illiterate, and so in which case, ordinary people are mesmerized and dazzled by the size of the car you are driving. they are mesmerized and dazzled by the amount of cars that are following you as a public officer. That's where our people want ordinary people to be. Elsewhere, and all you need to do is to just, a slight comparison between the attitudes of the ordinary politicians outside this country and what you see in a place like Nigeria. So the point to make is that there is no deliberate effort to insert the voices of ordinary people into public policy, precisely because people are afraid they may get the wrong question. And the wrong answers. If you may indulge me, I'll give you a very practical example, something that happened in Abuja. The story was told to us by the former World Bank president, what's his name, Holfenson, who said that when he came to Abuja and decided to have a conversation with ordinary people, just to hear the voices of ordinary people and how they were feeling about public policy and economic policy and what kind of impact it had on them. Wolfenson said that a poor man in Abuja told him something he had never had, and it changed the way he saw economics. He said this poor man who was brought in from a remote village came to Abuja, and the old man said that he had to cross 3 rivers to be able to get into Abuja. And that they've been crying for bridges, they've never found a bridge. But that to his greatest surprise, he has come to Abuja and he has found bridges, but there are no rivers. In his village, they have rivers with no bridges, but in Abuja, there are bridges, but no rivers. Now, he was talking about, the overhead bridges he was seeing in Abuja for the first time. So you have this policy disconnect, in part because people in public office are thinking on behalf of the people, as opposed to letting the people's voices feed into policy. And this is why the system remains volatile, including our politics, largely because the real voices of ordinary people never get fed into public policy.
Okay, thank you very much, His Lordship. Okay, I would like to just note that another panelist has joined us, Ms. Yemi Adamilokun. Thank you very much for joining in. Can you hear me?
Loud and clear. Good afternoon. My apologies.
Hi, thank you. No worries. And I would like to also say that the Minister of State will join us shortly. He's held up at the Polio World Conference for Polio. So as soon as he's done with his engagement there, he'll join us shortly. Thank you. Okay. So thank you very much again, Ms. Adamilokun, for joining us. I will go straight on to you and ask you what your thoughts are, regarding how much the Nigerian government has sufficiently empowered its people with knowledge, skills, and the confidence that they need to have.
I lost you, the end of your question.
Okay. So I'll take it again.
Okay.
Would you say that the Nigerian government in its health system has sufficiently empowered the people with knowledge and skills and the confidence that they need to know and to have about their health needs and the decisions and policies that are made concerning them?
Thank you. Again, thank you very much to HERFON for inviting me. Bishop Kuka, good afternoon. I'll start where Bishop left off. Sorry, my slight internet issue, but I'll switch on video shortly. I'll start where Bishop left off. I think the context really is what our political class understand as being servant leaders, being people who chose of their own volition to put themselves forward for public service. Nobody forces anyone to put themselves forward to be elected. And if you are, or elected, yes. And if you are appointed, you do have the free will to decline if you're unable to serve the people. But we have a system of government in Nigeria, governance in Nigeria, where the way to continue to run government like we do is to keep people illiterate and poor. Because when you do that, you take away the agency that people have to ask questions and to demand that the system of government works for them. Because ultimately the people we elect into office or who are appointed into office are there as stewards of our commonwealth. So they're there not for themselves. They're there because we're a country of 200 million people. There are, I don't know, 14 panelists here. If all of us panelists want to decide what we're going to have for lunch after this panel, Bishop might want fried rice. I might want jollof rice. You, Vanessa, might want ofada. Senator Mamura might want amala. Now, the process of coming to a consensus, because we can only order one thing, the process of coming to a consensus on that will take time and plenty engagement and negotiation. Okay, you choose today, we'll do your own tomorrow type conversation. And that's why we elect people into office. Otherwise, 200 million people cannot make decisions. So they're there to represent what we as citizens want. And basically, I say that all in summary to say that no, government has not done enough, or not really, it's not, and it doesn't, there's a difference is if you're having challenges and you are trying to, where I said government is not even making an effort to include people. Because when you include people, you give them agency, you give them voice, which then means you transfer the levels of power from government to the people. And we don't want that. So short answer is no.
Okay. Would you suggest that there are ways that governments can be more engaging with the community and the grassroots? Because some people would argue that a lot of the engagement stops at certain levels, but should trickle down and should take on a different approach. What would you say in terms of, the health system and the way that the government has it structured in that regard?
Okay, let's take polio, for example. We're celebrating World Polio Free Day. If the numbers are crunched, we will find that foreign countries have donated more or invested more in eradicating polio in Nigeria and on the continent. So I think it's not, and I think my premise is this. I mean, the more that government can do is for government's approach to governance to change. And that really is it. Because once your mindset, or as theory calls it, once there's a social contract where government believes it owes citizens development, it owes citizens to improve their quality of life, it owes citizens to give them access to health, to education, to social services, then the dynamics change very significantly. So the challenge we have is not because there's a lack of knowing what to do, it's a choice in choosing not to do it.
Thank you very much for that, Ms. Ademilokun.
Sorry, can you call me Yemi so that it's easier for you to pronounce?
All right, thank you. All righty, thanks. Okay then, so there are two questions on our inbox, one from Comfort Adeoshun, and she's asking, how can we engage and integrate health professionals outside the Ministry of Health and Academia to join this movement? Because she sees it as a movement. His Lordship or Yemi, either of you could respond to this. You're muted, my lord.
Well, I said I was going to ask Yemi to go first because she just gave a beautiful analogy about
okay then. Okay. Please, could you go, Yemi?
Sure. Sorry, could you repeat the question? I was transitioning between devices.
Okay. So Comfort Adeoshun is asking, how can we engage and integrate health professionals outside the Ministry of Health and Academia to join this movement?
So if you say Ministry of Health and Academia, the only other group will be those in public service, if I'm not then mistaken. Will that be correct?
Yeah.
Or in private service, so to speak. Yeah, in private sector service. Now, what has happened, unfortunately, over the years is that because of the challenge that we've had in our public institutions, private service has become, I'm not quite sure how best to engage it. Private sector healthcare has become sort of default. I mean, my parents were academics. I grew up at the University of Ife. We went to public hospitals, and that was the norm. So now you have people who work in public hospitals, but in a sense, they are consultants to public hospitals and they own their own hospitals where they refer cases because public hospitals don't have the resources they need to do their work effectively. And the truth of the matter is they can also charge a lot more in private in private hospitals. So to be honest, from a business perspective, I think private sector players have a different, there's a different, what's the word I'm looking for? There's a different underlying drive that drives how and why they're in business. So they tend to look at it more in terms of infrastructure. So if we had more electricity or infrastructure was better and because they are running a business. Now for the sort of overall health architecture for Nigeria really has to be driven in the public space. And it has to be driven in the public space from those who have the most to lose, and that's citizens. Because for those, I mean, we've seen that with COVID, and I would have thought that COVID would provide an opportunity for the public servants to understand what is at stake when they don't invest in public infrastructure. But unfortunately, I don't see that conversation happening because the public sector is what that drives policy. The public sector is also the one that can provide the scale, healthcare at scale, so to speak. So for me, private sector and citizens will be the other stakeholders that can go into this conversation. So if you look at the pot of it, you have the ministry and those who work for civil servants, those who work in the public institutions. Then you have religious institutions who own, the Catholic Church, for example, own quite a lot of hospitals, which they donated to COVID, for example, the COVID cause, for example. Then you have citizens who are the beneficiaries of this care. So when we don't have this health infrastructure, we are the ones that suffer. And then you have private players who, in a sense, for the most part, fill a gap partially. In addition to the fact that there'll be some specialties that government will not make sense for government to invest in, so to speak. So around the table, I believe, honestly, that the strongest voice in this conversation will be the people who are on the receiving end. So if you think about it, when doctors go on strike, it's citizens that suffer. It's citizens that are unable to get access to this healthcare that they would have gotten from public institutions. So civil society organizations, I believe, have in the health space, have a lot of work that could possibly be done in organizing citizens to understand how they can use their voice, in a sense, to demand better services.
Okay. My Lord, would you like to add to that?
Yeah.
Fine.
To add to what she has said, and say that, the two worlds are operating separately, as she's very well articulated. They need not be. Take a simple example. I believe my friend Femi Falana, senior advocate of Nigeria, is earning some really big money as a lawyer in private practice. But his capacity and ability to migrate in different directions and do all kinds of things suggests very clearly the possibilities. I don't think everybody who is in the academia, or even in private practice, is just committed to making money. Making money is important, but also a lot of these people with the right reflexes can provide their services. But very often what you find in the civil service is everybody's business, but nobody's business. Because there is a general complaint that many of the civil servants are neither servants nor are they civil. So you have a territoriality that arises from the fact that people feel this is my territory. And because people are quite territorial, nobody will want to go to offer services and make more than one trip. I have had a lot of people who came from diaspora, desperately anxious to fix one or two things. You go to the bureaucracy and you hit a brick wall. I'm not saying that there aren't people who are breaking their backs trying to do good in the public service, no, but that there has to be, and there needs to be rather urgently, a deliberate policy, again, that focuses on the welfare and well-being of ordinary citizens. About that, there should be no conflict, because the areas of conflict are also the areas of power, misplaced power, that is. But if it's about literacy and getting people back, back to health, we don't need to have a debate about that. But I think that a good number of people in the public, the private services are more than willing and more than able to provide their services across board. But the government has to create the necessary and enabling environment for them to offer their services.
Thank you very much, my Lord. It's important that you said that there needs to be deliberate policy that focuses on citizens' welfare, and regarding this, there should be no conflict at all. And government needs to provide the enabling environment for private sector to provide their services. I think these are two very key things that we need to take away from here. A lot of the attendees have questions. I'll ask one from Olusegun Esan, who's asking. He says, I believe state and local governments have a role to play in reaching the grassroots with qualitative and affordable healthcare system. Is there a way that state and local governments can be mandated to drive a revolution in the health sector? Ms. Yemi, please, would you like to respond to that?
Sure. I think the easiest way to frame it is the fact that you mandate people in public service with your vote. That's the only way. Not only voting on election day, but then after election day, honestly, I mean, people say I'm a troublemaker, and I kind of wear the badge proudly, because I really don't understand why you would choose to run for office, and then after that you choose to make my life difficult. I don't get it. It's quite confusing to me. So if we vote on election day, a lot of us then go to sleep for a variety of reasons. Either we say it's not my candidate that won, or I don't like the person that won, or it's government, they're useless. But in doing that, we in a sense legitimize their bad behavior because we're not holding them accountable. And Bishop said it really quite clearly. Look, this is the analogy I use for people who either run business or run organizations. So you have an office, you've employed staff. On Monday, the staff comes to work. On Tuesday, he shows up at about 11, and then he decides to leave about 2. Doesn't say anything, doesn't take any permission, doesn't write anything. On Wednesday, he doesn't come at all. No notice, nothing. On Thursday, yes, he wants to do work. Shows up at 9 and then by 2 says he just goes. On Friday, there's vigil in church, or he has to pray. One of the two. Either there's a night vigil, he's going to camp, or he wants to go to mosque to pray. So he's just really not really there. Now, this person does this day in, day out. At the end of the month, you pay him in salary in full. No query, no questions asked. So I do this in January, I do this in February, I do this in March. I do this for the rest of the year. You don't ask me any questions, but you pay me my money. Now, please, maybe someone can explain to me what the incentive in that dynamic is for that person to do better or to take their job seriously. As far as I'm concerned, there's none. And that's how we treat government officials. We let them into office. First of all, we don't show up on election day. So a few people elect, maybe not the people we want. We don't participate in politics. We say, from a religious perspective, some of us say it's dirty, politics is this, politics is that. And then we complain when people who represent us in the National Assembly can't speak English or don't understand issues. And then on election day, we don't show up. What, 20-something% voter turnout, 30-something% voter turnout? And that literally means 30% that showed up has decided who is going to drive policy for your life for the next 4 years. And then the people are then in office and you're upset that they're either APC or PDP, forgetting that the person that was PDP today was APC 2 years ago. Edo is a classic example. But you forget that and you're complaining that one person is APC or PDP and you leave them. Look, systems are driven by people. They're not driven by magic and they're not driven by aliens. So until as Nigerians, we decide that these issues are important enough in terms of our well-being and our welfare, that we want to do something about it, it will not change itself, not drive itself. So for the question around how do you mandate local government and state governments to do better, you mandate them by exercising, which is why I deliberately wanted this banner, exercising your office as the citizen. We say it in my organization all the time, that it's not the president, it's not the governor, that's the highest office. They're the highest elected office federally and at a state level. But in the context of a democracy, the highest office in the Federal Republic of Nigeria is the office of a citizen. Because if you don't vote, they don't have a job. And when you're voted then in, they work for you. So we need to hold them accountable, have these questions, scrutinize budgets, have engagements about how money is spent and what areas they're spending them on, if we want to get better outcomes.
Thank you very, very much for that and for your comments. Nigerians need to exercise their office as citizens. That's very important.
for you, my lord, there is a question from Felix Obi, who is saying, how best can we get the people's voice to influence health policy priorities? Nigeria has a national health policy, which came from 2016, and a 5-year national strategic health development plan for its implementation, which is undergoing midterm review at the moment. But our people are not aware. Nigerians do not know. So how do we as Nigerians drive policy and ensure its implementation and hold governments accountable?
Well, thank you very much. I mean, I think Yemi probably overstates the point when she says she's accused of making trouble. The fact of the matter is that if you live in Nigeria, you are living in trouble. So you don't even have to make it. But I also think that, you know, one of the things we've not resolved in Nigeria is what we mean by citizenship. Our concept and notion of citizenship is severely flawed, in part because it doesn't even address the political science concept of citizenship. We are largely, in very many parts of this country, living a semi-feudal, living in a semi-feudal environment and pretending to be in a democracy. All you need to do is to see what happens to the governor or the senator or the member of the National Assembly who are only Mr. or Doctor in Abuja. You go back to your village and you are prostrated on the ground before another lord, because from there you are a subject. You are no longer a citizen. As long as we have all these overarching traditional institutions, many of us are dividing our time between being citizens in one place, and you are citizen only until you enter the palace. Because once you enter the palace, you are a subject. Now, all these conceptual discrepancies largely explain why, you know, in asking for accountability, in asking for the things that drive democracy, we come unstuck when you import this conversation to Nigeria. So of course, we've never been short of policy. Fantastic policies, but everywhere you turn. As somebody was telling me, just today, that he went to an office in Abuja. I will not name the office, but it's an office that is heavily funded. And he said he saw tons and tons of Ghana must go bags all over the place where files are. And the man is asking the question, don't these people know about filing? Don't they know anything about how will paper still be on Ghana must go bags? I just laughed because, and that is not because budgets have not been created year in and year out. So we have an environment in which a policy, conceptualization has become suspect. And this has grown out of the last 30 or 40 years when the military taught us to despise intellectuals and intellectualism. Because if you remember Babangida's famous statement about our lecturers being paid to teach teaching what they're not paid to teach. And I imagine that Yemi should be familiar territory in that regard. And from that moment, being an expert became almost more or less a notion, that is open to suspicion. So if you talk about policies, yes, the policies are there. But the truth of the matter is that we have a constitution that is not in every classroom in this country. Okay, we have all these policy statements and they end up where they are produced, either in Abuja or in the relevant offices. So what really all this means is that if government has the political will, the critical thing you need to do is to democratize policy, in which case you have the mechanisms and the mechanics to ensure that a policy that concerns ordinary people is broken into a language that the ordinary people themselves understand. And as you know, in the National Assembly today, there are quite a good number of people, I'm told, who don't know how to sign their signature. Quite a good number of people who are not very much in tune with some of the principles that are embedded in policy. So a lot of people go into the National Assembly where laws are being made, and their concern is belonging to as many of these initiatives as possible. And there's more attention to oversight functions, which is the area of negotiation and barter, as opposed to thinking through very clearly what are the policies that really can impact on ordinary people. So the policies are there, but to give the policies traction requires more than just declaration. And I think this is where civil society comes in. But again, if you live in a dysfunctional environment like Nigeria, where government is everything, even civil society has to begin to think a bit more clearly in terms of how do you pay your bills and so on. So we need to continue to push the boundaries. And I commend the members of the various civil society organizations for the great and tremendous work that they are doing. And I think that perhaps if we focus more on energizing civil society, but also taking civil society away from Abuja and Lagos to the nooks and crannies of Nigeria, it is only then that we can create such a massive movement that can appreciate the meaning and significance of calling people to account. Otherwise, I mean, people in government will continue to act because they know that there is very little that you can do. Are you going to go to the police? No, they are there. And the image that Yemi created about the young man who goes to work or the staff that goes to work at whatever time they want, there are in reality a lot of young people who are still living that kind of life in Nigeria. And guess what? The big man in charge of the office can do nothing to them because of who their parents are, because of the nature of those who sent them. So you have a country where public service is just considered to be something that, well, you only do because you've got nothing else to do, or you are waiting for something better. So for me, these are the issues that, yes, the policy is there, but it needs to be broken down in a way, a manner that people can see themselves in the mirror, because that is the only thing that can give people a lot of interest, in terms of how particular policies are perceived.
Thank you very much for that response, my lord. Aminu Jaro Hassan also is asking, he's saying, how do we, okay, I think this has pretty much been answered in another question. That's just repetition. He's asking, how do we suggest to government on how to galvanize and strengthen our capacity for health policy systems research from bottom up in Nigeria? Considering that a lot of research is going on in different academic institutions, but how does government galvanize, strengthening our health systems, our capacity for health policy and systems research in this regard? My lord, would you like to respond to that, please?
Yeah, if you know, and we have no better mouth from which to hear than the mouth of the First Lady herself, her complaints about the quality of medical facilities in the villa itself, then you will appreciate the helplessness of ordinary citizens. Luckily for those who are in power, they really couldn't be bothered about this, and we've allowed them to get away with all of this. I think that perhaps what we need to begin to do now, when we talk about holding people to account, we should not allow only Labour and ASU and members of the Labour of NLC to be on the streets. One of the things that Nigerians have never come to terms with, and I think it's an area that civil society must pay attention to, is that after casting your vote, the next most strategic and most important area of engagement is not in the office, okay? It is on the streets. And I think, as we can see from Hong Kong to Sudan to Belarus, as we can see developments in other places, part of our problem in Nigeria is that too many of us are very comfortable. Nobody wants trouble because trouble has a bad name. Yet in reality, we are already in trouble. So I think that massive protests must be the way to go, whether in support or against particular government policies. Guess what? Even under the military, you also know that government liked the street. And where it couldn't control the streets, it decided deliberately to hire merchants to go and organize people. Remember the 2 million march, the 2 million man march, in Abuja, and a lot of all this. So I think, frankly, we need to begin to design policies that help us to embarrass people in public life when they don't perform. It would be nice, for example, and I think it is not strange, it sounds radical, but it isn't. If sick people decided to just go and sit out in front of the Ministry of, or the Office of the Minister of Health, if there is a problem, or if people go and sit out in the Office of the Minister of Education, or any minister for that matter, gradually, you will be calling attention to certain conditions, because embarrassment is the key word. If you borrow from some of the anti-apartheid movement strategies, some of the civil rights movement strategies in the United States of America, we cannot be wanting things on the cheap as it is in Nigeria, where we are just hoping that somehow one day we'll open a window and all of this evil has gone away without doing anything, or that the dirty work is only done by other people's children, not our children. And that the elite find that the easiest thing for them to do, if they are fed up with the medical services, fed up with the educational system, they simply export their children by stolen money or by hard-earned money, still in this dysfunctional environment. So there is a correlation between the persistence of our health slavery and our ignorance and our inability to assert our sense of moral revulsion. And frankly, like I said, I think that is really should be the way to go. Because once people in government realize that certain things that are certain limits that are not acceptable, then they will fall in line. And they will not fall in line because you've designed policy documents. They will not fall in line because you've had the freest and the fairest election. They will not fall in line because politicians are crooked. No, there are a lot of very decent human beings who are involved in politics. But I think that we citizens must design the best strategies for engaging the state, but also exploring the possibility of citizens that publicly call attention to the nature of the embarrassing condition that we are in, whether it's in the area of health or in the area of education and other areas of social services.
Definitely.
Hi, Ms. Yemi, is that something you would like to contribute to?
Almost definitely.
Yes,
this
please.
is why I love Bishop any day and every day. Look, the power responds to power. So when we spend a lot of time talking and analyzing, and as Bishop said, the policies are a dime a dozen. If we implemented every policy we had in Nigeria, we'd probably have the best country ever. But citizens, I believe, we need to value ourselves a lot more. And Bishop laid it out quite clearly when he also talked about that the Constitution is absent in schools. So we grow up not understanding our rights. Look, I see there are three things that have influenced the way Nigerians engage in 2020, like that has brought us here. Number one, our military history. So for those who grew up under military rule or then heard about it, nobody wanted to die. So you left them, except for those who took them on and said, look, we all agreed. And at the time that we were trying to kick the military out, everybody agreed that we fought that fight, that we did not want to be under military rule. Now, subsequent to that, that agreement has fragmented because people are in APC, people are in PDP, somebody's friend is APC. And so we're not agreed on the fact that we're fighting for social justice or we're fighting for equality or we're fighting for equal access to opportunities. We have not made that the anchor of our fight, which is what Bishop was alluding to. Whereas we didn't want military rule the anchor of our fight at that time, which allowed us to be able to, made us successful. But when your brother or your sister or your brother's-in-law is in government, the dynamics of that now becomes a bit more trickier. So our history of military rule affects how we engage government and how we understand people in government. Number two, our culture. Bishop again alluded to that when in his contribution around citizenship. So yes, that's the ideal under a democracy, but we have many layers for us in Nigeria that makes that not very practical. Traditional institutions and a culture. I'm a Yoruba girl. So it's very difficult to ask a 60-something-year-old, 65-year-old, how did you spend money? Like, where is that money? The dynamics of engagement in conversation becomes different because of just how we were taught to engage. We see asking questions as being rude or being insulting. So it's in our, we don't do it well, basically, and we're not equipped to understand it, both us that are asking questions and the elder who is in office, because he's putting his Yoruba elderness ahead of the fact that he's my senator that was elected to serve me. But he's his Yoruba older than me by 20 years that he wants to talk about and why my tone or my question is rude, not the fact that I'm paying his salary as the Senator of the Federal Republic of Nigeria. So we have that conflict. And then the third one is religion. Without a shadow of a doubt, religion has played a I'm a Christian, so I'll speak to the one that I know, a very, very detrimental role in the way that we engage the state. I'll put the Catholic Church on one end because the Catholic Church, as part of the process of being a priest, there's a process that helps you think through the good of society and your role in society in being a voice and being an enabler. You, as a priest, if I use that word, you are political, but you are non-partisan. And the Catholic Church understands that very clearly. How their pronouncements and their interventions can be very political, but it doesn't mean that they're partisan. So what Bishop will say if Jonathan is in government is the same thing he will say if it's Buhari, It has neither to do with who is in office, but the principle of his role as a priest. However, the Pentecostal church, which has a huge following in Nigeria, doesn't understand that role as well. And not only does it not understand that role as well, let me take that back, in not understanding that role, plays out a role that's very detrimental to how their congregation members think about the role of church in the state. So we've now come up with very nice phrases like, God did, God will do it, God is in control. God is not doing anything. God is not coming down to do anything because he has given the space of earth to his children. So whatever it is that we want to do on planet Earth, there's no God that's coming down to do anything. We, human beings, are the ones that are going to do it because we're the human beings that are here. So I believe in the way the church, and particularly, and for the sake of it, for some people don't worry, I am a member of the Pentecostal church, so I speak these things very boldly without any issues at all. We don't fully let people understand the power that is in our role as children of God and what that means on earth and what that means in terms of getting involved in the dynamics. I mean, Jesus walked the face of the earth, feeding the poor, healing the sick. He was involved in society. He said, give to Caesar what's due to Caesar. So he understood the role of the state. And so it's not that we're not to get involved. It's Christians that say, oh, politics is dirty. Why is politics dirty? Because this is the same politics that determine the policies that shape your life. So how can that be something you don't want to get involved in, shortless or just pray? So those three things shape significantly how us as citizens engage, I believe. And to Bishop's point, until we then actively understand our role as citizens, I understand Bishop's point about the challenge of that phrase, but really just as stakeholders in this country, if I want to use that phrase, and realize that the people we've elected into office were elected to serve. And my last point would be that for civil society organizations, it places a credible burden on us in terms of how we do programs and how we engage, because we need to pay a lot more attention into educating citizens around their ownership, or educating Nigerians around their ownership in this enterprise. So it's not work that should be outsourced to an NGO or to an organization. It's work that all of us as stakeholders in this Nigerian enterprise must understand and must take personal interest in for the good of all of us. I hope that made some sense, but yeah, that'll be my contribution.
Absolutely. Thank you very much for emphasizing those roles of history of military rule, culture, religion, and the roles that we play in the dynamics of engagement and what we should be doing differently to get the kind of results that we expect to have. Thank you very much, Yemi, for that. There is a question directed to you, Yemi, and Okiki Badejo is asking, how do we align the market interest of the private sector with broader health and social goals among populations that do not constitute an effective market?
Thank you. My perspective will just be in terms of shared prosperity. That regardless of how wealthy you think you are, I think there's a proverb, and Adie, I'm sure Bishop will know it, that you're probably as rich as the poorest person on your street. There's something to that degree. So I think the private sector needs to think about it in that regard, that no matter how comfortable they think they are in building a safe space for those who can afford their services and all of that, the more the population, the rest of the population is poor and unable to afford the services, the more unrest and insecurity you will have. COVID showed that to us very clearly, and I hope people took the lessons. And I'll use Lagos as an example. There are a lot of my friends in a certain part of Lagos who started saying, oh, we didn't know there were so many poor people. Now I know that's the work that you do. Now, I was glad about it, but it also shows how very disconnected we can be when we live in a certain bubble and we think we have access. So our kids go to private school. So all this conversation around education that we're talking about doesn't apply. So radio, TV, teachers in school who's protesting to come back or not come back, schools are going on, private schools are going on. And so if as a country, we don't realize, and that's what I've begun to tell my friends, and I'll use education as an example, that yes, your children are going to public school or private school, and they're able to continue with their education. but realize that as long as the majority of Nigerians who use public services are not in school, the education gap between the rich and the poor will continue to widen. And as long as it continues to widen, it means you're going to have a generation, your numbers of people who are ill-educated and ill-equipped to be functional members of society will increase, which then means you will have more insecurity, which then means that the safety of the children you've invested so much in is now threatened. So from a very selfish point of view, the private sector needs to take interest in public sector activities because ultimately they affect your quality of life.
Thank you very much for that. Private sector needs to be interested in what public sector is doing. I would like to announce that the minister has just joined us. Thank you very much, sir, and welcome.
Oh, it's my pleasure. I'm so sorry. I just had to just exit from where I am at the slightest opportunity. Please bear with me. I'm so sorry.
Thank you very much, sir. So I'm just going to go right ahead. And we've had conversations on people-centered policy from government and how that should trickle down or approaches should change. So I'm going to go right to ask you what mechanisms are in place on the part of government to ensure that there is grassroots participation in policy making.
Well, once again, let me offer my load of apologies for what we're having today is a post certification conference. You recall that just yesterday, 2 days ago, the WHO certified Nigeria polio free, and that calls for celebration. And so what we had earlier today was the post certification conference, and in fact it's still ongoing. I just had to step out because I have made a commitment to this. Now, having said that, thank you for inviting me. Now, you will recall that. Sorry, I think I have, since I'm doing this even in the car, I just have to step out. So
that's okay. We appreciate that.
Yes, you will recall that my own background is in the legislature. So taking that on board, the first thing I will say is that the most important role of a legislator is representation. So coming from that background, so I will say that it is not just desirable, it is inevitable for us to take on board the yearnings, the aspirations of the people in whatever policies that we are trying to put in place. So we must have the mechanism for engagement that should be continuous and regular. So in so doing, for example, from the Ministry of Health that I am right now, we have engagement through the Governors Forum. So that is engagement with the state. And from there, we have engagement with the commissioners of health in the states, of course, through the National Council on Health. Through them, again, we have engagement to the local government, and through the local government to the communities. So we have public hearing, we have town hall meetings, we have all these engagements. We reach out to the religious leaders, the community leaders, the traditional leaders. We need all of them. So that's a major one that we have to do, and we have to do on a regular and continuous basis. Because at the center of development is human beings. And every development, every policy has to be people-centered, people-oriented. So we are very, very conscious of this, and we try to do this in as much as we can. So it's very, very desirable, it's inevitable, and very, very compulsory that we do that.
Okay. I would like to ask you about the National Council on Health, which is the highest policy-making body in the health sector, but it is chaired by the Minister of Health and has 36 state commissioners of health as members. How are the voices of the people who are the primary targets of the policies heard? How can the NCH be made more inclusive to give the people more power in policy making rather than just have them as attendees?
Well, yes, because of the way the council has been put in place statutorily, so to speak, but we are not and we cannot restrain ourselves to that without bringing in these people. I just mentioned to you that we reach out to the to the states, to the local governments, to the communities through this forum. And of course, we still, when the opportunity makes itself available, we invite some of these people to be part of this. And whatever decisions that are taken will also be taken through them in terms of, in terms of implementation. So they can come on board, which we try to do, well, at least as they may not have voting rights, but then we need them, and we also engage the NGOs. We have some of these grassroots NGOs that make their contribution, which we very much appreciate. So we reach out because we know there is no way government can do it all alone. So it is just inevitable, it is imperative, it is desirable for us to continue to engage all these segments of the society because we need them to move forward.
Okay, I have one more question before I open this up for people to respond to what you have said. It's also on government policy, which many argue government policies which many argue are often influenced by donor interests and foreign policy more than being more people-centered. What's your take on this?
Well, my take on that is very, very straightforward. And when I say straightforward, you see, we need to tell ourselves the home truth. And what is that home truth? It is that we must have an attitude of being assertive in our demands.
Yeah.
As opposed to being submissive to wants. Mark my word. Being assertive regarding our demands as opposed to being submissive to the wants. Yes, often, so some of the time, the donor agencies, they have wants as opposed to our own needs. Yeah. So we must be very clear regarding our own needs and not their own wants. Much as we appreciate their contribution and their desire to help, to support, we must also be very, very clear in terms of our needs and be ready to push this through. Then there is also the need for us to be very, very unambiguous. We should not prevaricate, we should not be unclear in our minds as to what our needs are. We must state this very, very clearly. So when we do this, then they know that we are serious. Because if they find in us or an attitude of unseriousness, then it will help to continue to push their own position as opposed to our own position. The third thing to say is that oftentimes, I think one of the things that has happened that we have seen is inability for us to justify the support that had been given in the past. So there is need for transparency and accountability, so that, I mean, the popular saying is to whom much is given, much more is expected. So we have to justify whatever support, whatever grants that have been given to us, and when we justify in terms of transparency, in terms of accountability, then it will be easier for us to continue to say that, look, this is what we have done. But if they feel or they have a sense that what has been given by way of support is not being judiciously and appropriately expended, then that in itself may continue to put us in that defensive position of the donors coming to push their own the demands or their own wants as opposed to our own needs. So these are some of the ways that I think that we need to look at in order to justify and prevent the situation where the donor partners will just force their own desires on us and not our own needs.
Thank you very much, Honorable Senator and the Minister of State for Health. Thank you for that response. I would like to quickly say to you that other panelists are here. You're not alone. We have the Catholic Bishop of the Diocese of Sokoto, Most Reverend Dr. Matthew Hassan Kuka, and Ms. Yemi Adamiloku. I'm very sorry, I don't think I'm pronouncing your surname correctly, who's Executive Director of Enough is Enough. They're also on the panel with you, and they have carried on the conversation ahead of you. So please, I'd like to say welcome again to all three of you.
Thank you very much for inviting me.
Thank you very much, sir, for accepting our invitation. And against the backdrop of what you've just said, it's nice that you mentioned about Nigeria being judicious with spending, being assertive as per our needs against what they want, and then being transparent. But in your view, would you say that we have lived up to these expectations that you have outlined in terms of donor funding?
Well, yeah, I won't say that we have, perfectly, because it's about issue of confidence and trust.
Yeah.
Yes, we may not have justified all that in all the programs. There are so many programs. You have the malaria program, you have the HIV, you have nutrition. You have something that it starts what appears to be trust. That look, it's like we have not justified in some of this, not in all the, but maybe in a few places we probably might not have done that, and that is where the issue now arises. So we might not have been perfect in all these programs, but largely we have complied in terms of expectations, and this is part of the confidence building and trust that I expect in the system between the donors and, of course, the recipients.
Thank you very much. I would like to ask the other panelists if there are things that they would like to respond to and engage with regarding what the Honorable Minister has just said. Ms. Yemi, I'd like to go with you first, if you've got.
Thank you. Good afternoon, sir. How are you?
Yemi, good to see you.
Good to see you as well. Thank you. I was just curious.
Good afternoon.
Good afternoon. Post-COVID, are there any specific sort of learnings? Now, this is our 6th month, I guess, that is learnings from this season that's going to be implemented in how the ministry sort of implements health policy in Nigeria moving forward? Did you hear me?
Yes, definitely, because I always say that COVID, at the end of the day, it may not be entirely bad situation, because I heard you. Hello?
Yes,
can
we
you
can
hear
hear
me?
you. Yes, we can.
Yes, I heard Yemi. I was just telling her that I heard her. And I was saying that COVID, it may just be a blessing in disguise, in the sense that, yes, no doubt we have a weak health system. But, for example, one of the gains that we are already having is a kind of inevitability for states to now put in place infectious disease hospitals. Again, COVID experience has made it clear for us that we must be ready at all times. The Boy Scouts motto, which is be prepared. Now, and for you to get prepared, it means that what you need to put in place by system strengthening in terms of infrastructure, in terms of human resource for health, in terms of attitude, in terms of everything, you have to, and that's what we are trying to do now. We are talking of IPC, infection prevention and control, use of PPEs and all that. These are things ordinarily, as much as possible, particularly in any infectious disease environment. These are things that ought to have been part of our routine. So we are now being forced to appreciate that reality. Again, there are a number of other things that are not directly in the health sector, but outside of the health sector. For example, the issue of water supply, the issue of electricity. These are things that must be put in place. We have our primary health centers located all over the place. But what do we have? A situation of non-functionality. So we must ensure, and that's what we're trying to do, that these health centers are functional. Functional in terms of having water supply, functional in terms of having electricity supply, functional in terms of even having ambulance service that can convey patients from that level to a level of secondary care. We must have functional in the sense that the essential drugs are available, functional in terms of the essential human resource for health is available, in terms of services, the basic services, nutrition, health education, antenatal care, immunization, so that we won't be having a fire brigade approach when the need arises. So these are some of the things that we are getting even from our COVID experience. Of course, our labs must be functional so that we are able to test what we need to test. We are talking of molecular laboratories as at this point in time. That's why we are now having these laboratories opened all over the place and throughout the country. We are opening, sample collection centers. These are things that ought to be on ground ordinarily, so that when the situation arises, we will not be scampering in order to get these things done. So these are some of the that we are trying to push, and we have a kind of checklist as to what we need to have in place. And don't forget, from the center, that is from the Federal Ministry of Health, and through our agencies, NCDC, National Primary Health Care Development Agency, through the Port Health Services, through all these agencies, what we are doing is to support the states. So we need that collaboration which we are building upon with the states, because we can't just get to the states. We are talking of opening emergency operation centers. We can only assist the states in setting up this thing. So there is need for synergy. There is need for collaboration. There is need for understanding. But all this we are trying to put in place.
Thank you very much, Honorable Minister. Yeah. Okay, very quickly.
Yeah. It's just brain drain. I read a report in Punch saying that once the borders are open and people can fly, there's an expectation that a lot of our medical personnel, given this was a global pandemic, and could have better terms of service in other parts of the world. Is the ministry doing something actively to retain some of our best talent?
We are, but we need to do more, because the question to ask is, why are these people leaving? They are leaving for a number of reasons. They want conducive environment to practice the trade, which they have learned. They need, what you can call encouraging conditions of service. They need the collaboration, even among the other health workers in the system. Whether we like it or not, salaries, emoluments, allowances, they are part and parcel. of what these people need. And it may be difficult to provide all these things in one fell swoop, but we are trying to address in as much as we can, taking cognizance of the other competing needs, but we are pushing this to the front burner, because that is what we need to do, is to address the reasons for this their emigration. Those and the reasons are not far-fetched. So we are looking at this. We are increasing you know that in NHIS now, National Health Service, insurance scheme is now being made compulsory, so that we can now get more people into the net and be able to reach out, because it's still one of the most important ways of funding healthcare delivery. So we are looking at all this, taking a kind of holistic view at them, and we are trying to address them in as much way that we can.
All right, thank you very much, Honorable Minister. Bishop Kukah, would you like to engage with what the Minister had said previously?
Very little, really. I mean,
okay.
Hello, Senator. Good afternoon.
Oh, good afternoon, sir.
Good to see you, and thank you for the sacrifice. Just a question that somebody like myself, who comes from the middle of nowhere, given that even at the level of health services, the kind of health visits that we have from people who are coming from our citizens in diaspora, there's a lot of that traffic, but going to only villages from where those kind of people come. And given that in Nigeria, very often facilities, government patronage is based on whom you know, and if you are in a position to influence, the result is that there are many communities that have no influencers. They don't have access to those who matter. In other words, what effort is really being made to democratize healthcare services beyond, especially in collaboration, with the state governments?
Thank you very much, the Lord Bishop. Now, let me start by saying that one of the goals of this present administration is in the health sector is to make at least one functional, I repeat, one functional primary health center available in each of the close to 10,000 political wards we have in the country. And I earlier on enumerated what things that need to be put in place to say this is functional. And I'm sure that if we have this put in place in at least one political ward, that would have gone a long way in achieving this close to universal health coverage, because you're talking of accessibility, you're talking of affordability, and the reach is there. Now, our healthcare workers, doctors, nurses in diaspora, we have a department in the ministry that caters for their activities and want to bring them home. And one of the things we try to do is to identify where the needs are, so that they don't just decide on their own when they come for this medical mission. We want to identify where they are really needed and be able to direct them to such areas. That's one of the things. We have engagement with them, the doctors, health workers, nurses, and what have you in diaspora. So we have engagement with them to partnership so that we can achieve more. Then I do know that through the National Primary Healthcare Development Agencies, they have all these people, chiefs, CHUs, and all that, who also are part and parcel of the system. And they monitor what is going on in each of our communities, well, at least to the best of their ability. And we have a kind of feedback in the system to be able to know to put in place. But basically, once these essential services are available in these locations, that is the primary healthcare centers that I have just described as need for them to be functional, we will be able to at least limit, or if not eliminate, limit and reduce the problems that you have brought up in your intervention.
Okay, thank you very much, Honorable Minister. I would like to ask questions from the attendees, which they're posing to you directly. There's somebody, Dr. Eboreme, who's asking, do you think the National Council on Health needs to be restructured to give the people more voice and voting rights in the council where decisions that affect them are made?
I can assure you that personally, I'm not opposed to that. In fact, it is welcome. So it's something that maybe at the next Council on Health meeting, we can raise it and interrogate it together. But if you ask me as in my personal capacity, I will say it is desirable.
So can we say that that's something we can keep our fingers crossed over that you'll be pushing for?
By the grace of God.
All righty. Thank you very much. There is another question about how NGOs and patient groups can join the NCH and actively contribute to decision making. This is from Sylvester Adeyemi.
Well, I think I addressed that earlier on, that the more the merrier. You see, when you widen the decision-making base, then you are likely to get better results. And you are likely to even have better ownership and, confidence in the system.
He's asking, how can they be a part of this? Do they do this at the state level, at the local government level, or at the federal level? How can they become a part of this, or a part of the group, or a part of the wagon? Well,
I did say earlier on that we interrogated that, and with a view to working out how they can come in. Even if they're not having voting rights in the council, but at least it can be part of debate and make contribution.
Okay, all right. There is another question where somebody's asking that there are instances where big industries and corporate organizations in collaboration with government. He's alleging that they exploit local governments and and wreak health havoc. And that there is an organization, Kappa Africa, which recently released a report on moves to privatize water in communities in Lagos and several other states in Nigeria. And he's saying because a lot of health issues revolve around water and affects grassroots and other communities. He's asking against this backdrop that do you think privatizing an essential commodity such as water is not an abuse of their human rights, and maybe their access to a fundamental part of health needs, if you look at COVID and the need for water?
Well, I mean, the first thing to say is that as in the popular saying, that water is life. So potable water, in fact, there have been statistics to suggest that when you have potable water supply, you probably will have reduced the disease burden by close to almost 40%. And that is very significant, because we say common things occur commonly, in medicine. In which case, the common things that you see, that there are rare diseases, oftentimes, coming from poor water supply, cholera, typhoid, and all these things. So that is, you cannot overemphasize the importance of a potable water supply to every community, and for people to have access to that potable water supply. And so, having said that, again, we also need to appreciate that we are operating a federal system. And the federal system, the government and the center also has its own limitations, especially within the ambit of the Constitution, which is the ground norm for the country. So the states, they have their own roles, and that is why we have this engagement and collaboration, so as to be able to advise and also give support where necessary. So we push some of these policies But then there's even a limit to which you can push this, is because the states, they also have their own priorities. But we say, we say that certain priorities, even among priorities, you must have, or even among equals, you have first among equals. And we try to push this in as much way as possible. But as he said, or whoever was asking that question, if we get some of this report, then we will have information to work on. We're not saying that the system is perfect, but there are things that we can push and bring to the knowledge of the state authorities, and through them, even to the local governments as well, and be able to make amends as desirable.
Thank you very, very, very much, Honorable Minister. And Bishop Cook and Ms. Yemi, we've had this conversation going on for about 2 hours now. It's been very interesting. I'm not sure if anyone has a final word, but I would like you to say some final notes against the background of the conversation that we have had. We have a lot of takeaways from here, from what our roles are as citizens in our demands for things that should be done concerning our health, and what government needs to do, and how we can engage both ways, citizen government and government citizen, rather than have conflicts in the process of decision making. I would like Ms. Yemi, please, if you could say any final words against the background of our conversations today.
Thank you. Thank you again for inviting me. One of the things when Enough is Enough Nigeria started was that we focused on transparency and accountability. And when we engaged different stakeholders, people were like, oh, that's governance. We don't do governance. We do health, or we do education, or we do environment. But what we were able to do very quickly is let people realize that embedded in every sector that people might have an interest in, us, all of it is embedded on governance, on accountability, on transparency, on our decisions to engage. Health is wealth, we say, and we really need to pay attention. I think if there was any time, it would be now for us as citizens to really understand what is at stake. God has been kind, and that's what I would say in terms of how we've been impacted by COVID. We didn't see the dead bodies that were predicted that we would have. And the people who predicted it just looked at data. They looked at how it was working in other countries and looked at Nigeria's healthcare infrastructure. And it was very easy to come to that conclusion that if COVID hit us the way it's hitting other parts of the world, we would literally have had bodies in the streets. But God has been kind in the strain of the virus that we've had, or in whatever is built up in our immunities, maybe from our dysfunctional healthcare system, that has allowed us to cope in this manner. But we did Ebola, we succeeded relatively. We've gone through this, it's not yet over, but the sort of the peak of it seems to be coming down in terms of death rates. But I would really like to encourage, for those of us in the civil society space, and I mean, Bishop has spoken quite significantly to the role of the church, to take our lives seriously. That ultimately the deference to, because a lot of the questions that I saw was, what can governments do? How can governments do? How can governments do this? Bishop has said that the policies are there. It's not a need for a new policy or a new structure. It's really about the human beings that we have who have chosen to lead or put themselves forward to lead, and now us as Nigerians engage that power dynamic. As Bishop said, and I'm still waiting for this day, and I know it will come quite soon at the trajectory that we're doing. When citizens literally organize themselves and go and sit in front of a minister's house or a senator's house and just be like, no, this is unacceptable and you must do something about it. And this is not about we want rice or we want Ankara, but you must do something about our quality of life. That level of interest and engagement is where we need to think of to get the social services that we deserve as Nigerians. Thank you.
Thank you very much, Ms. Yemi. I'd like to, I'm not sure if the minister is still with us. I know that he has a plane to catch, but if you're here, sir, please could you say some final words and we'll let you go. Thank you so much.
Well, let me thank you for inviting me to be part of this. And I want to equally thank my co-panelists, Yemi, my dear sister Naburu, and of course, the Lord Bishop, my good friend. Thank you very much. We appreciate your, your contribution as individuals and of course, as civil society, as religious leaders, because you see, there's no way government can do it alone. And you are even in better position to continue to, just give us that push, so to speak. We don't claim to have all the knowledge. No, we are just privileged by grace to be where we are, but we also have a duty. We have a duty, we have a responsibility, and we will continue to do that within the ambit of the strengths that God has given. Now, one thing that I need to say in parting is that we need to find a way to strengthen our local government system. You see, because that is what we refer to as the grassroots administration. And these local governments are there for a purpose. So we want them to be more efficient and more functional. And one of the things I have advocated, but I cannot do it alone, is that much as we need the local government, we don't need the present system of, what you call having the legislative body and all that. I think my own position personally is that we should have a kind of, not a presidential system of the local government, but a parliamentary system. So that would be reduction in terms of overhead and personnel cost, and then we can then free some funds for developmental purposes at the local government. That has always been my position as far back as when I was speaker, and I still maintain that position. So we need to look at that so that we can free more funds. There's a large chunk of money that goes into personnel and overhead. So thank you very much. Well, the conversation continues. It's not going to end here. It continues.
No, it's not. Thank you very much, Honorable Minister. We greatly appreciate that you've taken time out to be with us. I would like to let you know formally now, we'll do that later as well, that you're SDI champion, SDI Systems Development Initiative, which is a group that has come out of this event by those of us in Nigeria who have put together, this convening. Thank you very, very much again, and have a safe trip.
Thank you very much. Bye-bye to everyone.
All right.
You don't have to go yet, Senator. Wait and listen to Bishop, since we're wrapping up. If you don't have to go yet.
Okay, my Lord Bishop, are you still there?
Okay.
My Lord Bishop, are you there? Oh, okay. It seems like we've lost him.
No, he's there. Bishop, you're muted. He's here. I can see him. Bishop, you're muted.
I'm here.
Okay, okay, yes. Okay.
My battery is at 2%, but anyway, just enough time for me to once again thank Dr. Mamora. I think actually you've made our anxiety a bit, how will I put it? You've made us less anxious. And I think, frankly, when I look back at where we were with civil society, people like you that have come from a tradition of struggle, we can only call on you to do two things. One, to remain open to new and fresh ideas, because we didn't just struggle against the military just to be able to conduct elections. We struggle against the military to be able to have a voice and make sure that our voices matter. Where we are now is where we ought not to be. So first of all, I want to commend you for your flexibility, your willingness to listen to different opinions and to keep your doors open, because I think we must do this then, but our country is ours to save. So once again, thank you, but thank very especially Vanessa and all those who have organized this event. It's been a wonderful chat. I think we should do this again. Thank you very much, and God bless you all.
Thank you. Thank you very much.
Thank you,
Thank
Bishop.
you all so much for being a part of this conversation. And like everyone has said, please let's keep the conversation going until we achieve the kind of results that we're hoping for. Thank you very much. So I'll pass this on to Ms. Kasarachi to say the final closing.
Thank you very much, Vanessa. Thank you to the Honorable Minister for gracing us with your presence. Thank you to our Lord Bishop Kuka and the Admirable Ms. Yemi for honoring our invite. Honestly, this session has been very explosive and insightful. So I also want to thank our participants who have been online since the first session. We are grateful and we hope that you have learned and gleaned some insights from this session. So Vanessa mentioned SDI, System Development Initiative, and just to reiterate that it's the organization that put these conversations together, and to say that we are forming a community of practice which will comprise of researchers, policymakers, CSOs, and everyone interested, citizens, to take these discussions forward. We've generated a lot of conversation in the past 2 days, and it wouldn't be fair to just leave them hanging. We need to get definite outcomes or outputs from all these conversations we're having. So the details of the COP will be sent to your emails in the course of over the next week, and we hope that you would join the COP and make Nigeria better and make HPSR in Nigeria better. Thank you very much. Thank you once again, everybody. And over.
Thank you. Bye.
Thank you.